I'm not sure if you're talking to us, but we don't have any sound coming from the boardroom at all.
Nicole, can you hear me?
Yeah, I can hear you just fine.
I can hear you. I've seen Dave, I've seen Jay Ehrlich, and that's it.
Yep. It looks like the boardroom's mic is muted.
I can hear both of you plainly.
There's Tony.
Testing.
I texted Ruth. She said they're working on it.
Can you hear us?
Yep, we got you now.
Can you got us now?
Feeling safe today.
Okay.
Thank you.
So we'll go to Dr. Williams, but before that, I would just say that Legislator Fiacco will be excused at 6:25 p.m. And for the operations meeting, I will be chairing that meeting in place of Chairperson Curran. So Dr. Williams, are you going to be the first presenter?
If it's okay with the legislators, I'd like to have Jolene go first.
It's okay with us. Jolene?
Hello.
Hello.
Let me just get
We're waiting to hear your presentation, Jolene.
okay. Okay. So as of today, we have 7,028 cases to date. We had 7 new cases today with 7 current hospitalizations. So we have 129 active cases and 6,804 have completed isolation. And we have had 95 cumulative deaths since March. Our daily hospitalizations are staying underneath 10, which is great, but we are seeing that they are slightly upticking. So we do have 7, which we haven't had for several days. Our weekly cases are still higher than we would like them to be. So with 1 week left in the reporting, 1 day left in the reporting week, we have 111 cases this week. It is down from 159 cases last week. So our average new cases per daily cases is 15.9 as compared to 22.7 last week. Our weekly school cases, though, have increased. So far, we have 26 this week with 1 day left in our reporting period. And these are the K-12 school cases. Last week, we had considerably fewer. So we are seeing quite the increase as the students are coming back from spring break. Our college cases are going down. For the last couple of weeks, we had 57 and 58. This week, we only have 15. And then for isolation and quarantine, we have had 31,123 go through active quarantine and isolation. So just some new updated guidance. DOH did publish guidance for the end of academic year celebration. So effective May 1st, graduations may be held following the guidance for that specific venue, wherever it's held. And effective June 1st, end of year academic social gatherings organized by educational institutions such as proms and balls may occur with restrictions based on the venue and capacity restrictions at the time of the gathering. DOH also updated the travel advisory as of April 10th. there is no longer a travel advisory for domestic or international travel for asymptomatic travelers. They still recommend precautions for all travelers, regardless of vaccination status. When you return from traveling, you should still monitor your symptoms from the day of arrival for 14 days and continue strict adherence to all recommended non-pharmaceutical interventions, including proper hand hygiene and the use of face coverings through day 14, even if fully vaccinated. And immediately self-isolate if any symptoms develop and contact your healthcare provider. So for bars and restaurants, effective today, bars and restaurants can stay open until midnight. The executive ordering requiring patrons to buy a drink still remains in effect. For our county vaccine distribution, we as a public health department have administered 4,344 first doses and 2,908 second doses. This week, we are doing vaccine clinics in Ogdensburg, Messina, and also the vulnerable population. And then next week, we are in Gouverneur and still continuing with the vulnerable populations. I wanted to just re-show the slide again for the vaccine finder, just as a reminder on where to go to find what vaccine is available within a certain zip code. And if you're looking for a specific vaccine, this will tell you who has what for availability. And then the public health department is also starting a vaccination campaign similar to the I Wear a Mask. Information will be going out this week with signs for businesses on I got my COVID-19 vaccine because. And then even after you get your vaccine, you always want to make sure that we are still wearing masks, following proper hand hygiene and social distancing. And that is all that I have.
Mother. Mr. Denisha?
Thank you, Mr. President. Jolene, this is Larry Ganesha. Last week at our Office for the Aging Advisory Council meeting, you mentioned that one of the towns within my district was only at 40% of vaccination for the 65 plus population. That concerned me, and I got to doing some looking around, and there's a large number of that population, the 65 plus in that particular township. They go to Florida for the winter. So they weren't here to get their vaccines. My question is, if they get their vaccines in Florida, when or how does it transfer to St. Lawrence County so that we know that it's not 40%, but indeed it is 75 or 80%?
So there is currently not a national vaccine database. If they received it in Florida, it's not going to be reflected in our numbers. In order for them to have it reflected in our numbers, they would have to give the data sheet that they got it. So wherever they got their vaccine from, they would have to provide it to us and we could enter into the state system for them.
Oh, if I may.
Yes.
So in all actuality, the data that we have could be skewed. Is that correct?
It could be, yes. It would just matter of if they're coming back and they want proof of where they are. It also would be a matter of what they have for their permanent residence.
Okay,
for the census.
So, Mr. Akers?
So Jolene, could you talk about public health efforts in actually vaccinating in the farm community? I'm hearing rave reviews, and I'd like you to talk to the rest of the legislative body about what you've accomplished.
So we took a couple of days and we worked in conjunction with the Cornell Cooperative Extension who garnered interest and helped us do signups at the varying farms throughout the county. So we took 2 days and went to 11 farms, and some of the farms that had fewer populations went to some of the larger farms that were near each other. We went out and we vaccinated a combination of migrants and American farmers on over 2 days. The first day we did 81 vaccinations. The second day we did 84 vaccinations.
Excellent. I want to thank you for your efforts and initiation of this program. Really appreciate it.
Margaret.
Ms. Hager?
Thank you, Mr. Chair. Ms. Munger, there seems to be a nationwide trend towards younger people being hospitalized because of the variants that are out there. Have we seen any shift in the age bracket of people being hospitalized?
I would like to defer that to Dr. Williams.
Okay.
So the same trend that's being seen nationally is being seen locally. I'll point out that one of the reasons for that is the younger people are not getting vaccinated or have not had the opportunity to be vaccinated at the same rate. And so, since we know that vaccination, as you'll see in my presentation, is very effective, I think what's happening is the downward shift in age is probably as much a reflection of the vaccination patterns as anything else.
Does that answer your question, Ms. Hager?
Yes, it does. And I'll wait to hear what else Dr. Williams said. I appreciate that. Thank you very much.
Are there any other questions for Ms. Munger? Seeing none, Dr. Williams? Thank you, Jolene.
So good evening. So I was going to, I'm actually just going to focus on vaccination. So that was, I guess, a good segue. So I do like to just give the national perspective on these issues. And if we look at what's happening nationally for vaccination, for a total number of doses that have been administered, it's 209 million plus some. So quite an effort that's happening on a national level. If you look at who is being vaccinated, at least 39.5% have received one dose. Only 25% of people in all age groups has received both doses of the Pfizer or Moderna or a single dose of the Johnson & Johnson vaccine. If you look at the map, what you see is, as with many things to do with COVID, there's some variability of the vaccine rollout program. And you have Mississippi at 29%, and these are for at least one dose. You see New Hampshire at 58%, and then New York State as a whole is 43%. And again, that's people receiving at least one dose. So just to give the national perspective as I talk about what's happening in the county. So for St. Lawrence County, and this is data that is up to date as of about a half an hour before the meeting. So for total doses, there have been more than 77,000 total doses, keeping in mind that many of these vaccines require 2 doses. So that's not 77,000 people being vaccinated, just that's the number of doses that have been administered. When you look at people who've received at least one dose, if you look at out of the total population, we're at 39.8%. If you look at the eligible population, so that's the people who are of an age where they can receive it, it's at 48.6%. As far as the type of vaccine that people have received, and this is relevant when I start talking about the Johnson & Johnson vaccine. So Pfizer is the vaccine that's been given to the largest number of people in our county. Moderna is the second most popular, most common one to be administered. And then this says Janssen, it's confusing. It's Johnson & Johnson worked with Janssen to make the vaccine. But as you can see, it's a relatively small number of people who've received the Johnson & Johnson vaccine in our county. When you look at the demographic is from an age perspective, what you see, and this is the graph that has the ages across the x-axis. So this is 60 to 69, 70 to 79, and 80 plus. What you see is that for 80 plus, it's at 73%, and these are people who've received at least one dose. For the 70 to 79 age group, it's 83%. And for the 60 to 69, it's 72%. So those are the age demographic, that's the age demographic that we're especially concerned about, because those are the folks who are more likely to be hospitalized or to otherwise have a poor outcome with COVID. As far as the Johnson & Johnson vaccine, I did want to give everyone an update. I think people have largely read this in the news, but there were 6.8 million doses that were administered on a national level. And the vaccine safety monitoring system basically detected that there were 6 cases of an uncommon disease called central sinus venous thrombosis with low platelets, so CSVT. And of the 6 people who were documented to have this, 1 person did die. The clots occurred in women ages 18 to 48, and they seem to occur within the first 2 weeks after vaccination. So based on this, the FDA and the CDC recommended that there be a national pause in the administration of the Johnson & Johnson vaccine, and they called an emergency meeting of the Advisory Committee on Immunization Practices. That committee did meet this past Wednesday, and they essentially recommended that they get a 10-day period where they could evaluate the safety data and make a determination about what the next steps are. So at this point, they're in the phase where they're just reviewing the data. They're first of all confirming that these cases really could be attributed to the vaccine, and then they're going to give recommendations about what the next steps are. It's possible that they'll recommend to continue with the vaccine for all age groups. It's also possible that they may suggest that the vaccine be used in people who are 50 or older, but we'll just have to see what they decide after they've gone through all the information. So as far as an update on the Pfizer and Moderna vaccine, which are the ones that we're, again, using predominantly and for now, the only ones that we're using. Since my last presentation, there's actually been a lot more information confirming both the efficacy and the safety of these vaccines. So I just wanted to briefly review that. So it's now fairly clear in many studies in many countries that these vaccines are at least 95% effective, both at preventing illness and preventing hospitalization and preventing death. They're also very effective at preventing asymptomatic transmission of COVID. Most of that data is coming out of Israel, where they have a very high vaccination rate from early on. It's also highly effective against COVID-19 variants, especially and specifically the UK variant, the B.1.117, which is now the dominant variant in the US. It's very clear that both of these vaccines are highly effective against that variant. The duration of immunity, and I'm going to talk about that a little bit more shortly. The numbers, the time frame 6 months was published, and I just want to be clear that that means it's effective for at least 6 months. So the original trial participants are continuing to be assessed, and what Pfizer and Moderna are both publishing is that for at least 6 months, these people have very high levels of immunity. Over 200 million doses of both of these mRNA vaccines have been administered in the US, and unlike the Johnson & Johnson vaccine, there are actually 0 reports of this CSVT with low platelets reported. And overall, with everything that they're monitoring, there have been no new safety concerns or reactions reported about the Pfizer or Moderna vaccine. So I thought I'd go through a few frequently asked questions, and these are questions that I've heard from my own patients, or that I've heard in the public health context. So now that the age for vaccination is dropped to 16 and above, I think a lot of people are asking, I'm young, I'm healthy, I don't have risk factors personally for severe COVID infection. Should I get vaccinated? And the answer is yes. So firstly, the risk of severe COVID infection is actually very low for many younger people, but it's not entirely predictable. And we certainly have seen young people who become ill, but maybe more concerning for the younger folks is this long hauler syndrome. And we've talked about that over the past year. There's now more data coming out, and in the United Kingdom, where they're especially focused on long hauler syndrome, their national statistics database published something that said between 15 and 25% of younger patients have at least one major symptom at least 5 weeks after the initial infection. However, I think the other most compelling reason for younger people to get vaccinated is that while vaccination protects you as an individual, it protects your family, it protects your parents, your grandparents, maybe your coworkers, people in your religious community, and your neighbors who themselves may be at risk of severe COVID. Another question that comes up, can I get COVID if I get the vaccination? The answer is emphatically no. So none of the vaccines contain the COVID virus, or really any part of the COVID virus. These vaccines are just designed to help your body develop protective antibodies, and there's really no possible way for you to get COVID infection from the vaccine. Another question, since this most recent news, does this new information about the Johnson & Johnson vaccine related clots, does that mean that all the vaccines are not safe? And the answer again is no. So the vast majority of vaccination has been done with the Pfizer and Moderna vaccines. They use an entirely different vaccine technology, both from the Johnson & Johnson and the AstraZeneca vaccine. So these vaccines actually have an amazing safety record, as I reviewed earlier, with hundreds of million, if you look at other countries as well, doses have been administered starting almost a year ago when the clinical trials began, and there really aren't any new specific safety signals other than rare allergic reactions, which were determined early on. And the other thing is the possible association of clots with the J&J vaccine, if that's proven, is actually exceedingly rare. So right now, of 6.8 million doses, there's been one death. And the risk of complications from COVID, really in all age groups, is far greater than 1 in 6.8 million. So another question is, if I get the vaccine, will it protect me from the variants? And again, the answer is yes. So the current vaccines in all the data that has been done, both from lab research, but also in the real world, including in Israel, again, where there's been a lot of vaccination and a lot of the UK variant, these vaccines are very effective against especially the UK variant, which is now the dominant variant in the US. There's other data that suggests that they're also very effective against some of the other variants. Pfizer recently announced that of all their trial participants who are in South Africa, they had a 0% infection rate. So they're translating that to be 100% efficacy. The other important factor is that widespread vaccination actually shuts down the ability of the virus to mutate. So by getting vaccinated, you're both protected against the current variants, but you're also helping prevent more variants from developing. Another question that comes up is, if I get vaccinated, will the effect of the vaccine wear off quickly? Like, will my immunity go away quickly? And will I need to get more shots? So the answer to this is a little more complicated. So, what we know right now is that vaccination with a Pfizer and Moderna vaccine lasts for at least 6 months. So far, none of the trial data suggests that the antibody levels are waning or decreasing, but we know that that can happen. Right now, however, we don't know, is it going to be 6 months? Is it going to be 9 months? Is it going to be a year? I do think, and the CEO of Pfizer has announced, that it's fairly likely that there will be at least an annual kind of follow-up vaccination, or at 1 year. And it'll either be a booster, so just a third shot of the same vaccine. It's possible they'll make some modifications or update the vaccine to reflect some of the variants that are circulating at the time that this is given. It's still not clear, though, whether this vaccine is going to be like the polio vaccines, where 1 or 2 shots is sufficient, or if it's going to be like influenza vaccine that, as we know, is recommended annually. Question I've heard as well is if, more than 80% of the older population has been vaccinated, have we achieved herd immunity? And the answer to that is no. So herd immunity refers to the immunity rate for the entire susceptible herd, which is all of us. Not to refer to everyone as a herd, but I think we understand. Immunization of younger people in the herd is essential to protect the older, more vulnerable part of our population. And that kind of gets back to my first frequently asked question. And vaccination is really highly effective, but it's not perfect. So vaccination becomes more effective as more people become vaccinated. And if you go back to what we've talked about over the years, or what people know about herd immunity, this is sort of the essence of what herd immunity is that the more people who are immune within the herd, the more protective it is of everybody else. Jolene touched on this a little bit, but I think people want to know, if I get vaccinated, what actually changes in your daily life. And I think, what I just underscore that basically it significantly increases the activities that you can do safely. And we've talked about social distancing, a term I don't like. I like physical distancing, but the reality is there's a lot of social distancing that's happened in this community, in every community, and I think it's been very damaging. So vaccination is a pathway for people to reconnect. And specifically, at least according to the CDC, they're suggesting that if you're vaccinated, you can visit with other vaccinated individuals safely indoors without a mask. That's like in a private residence. You can also safely visit unvaccinated friends and family from one household without a mask, even if like the child or grandchild is not vaccinated. The CDC has a nice website on this that I'll provide a link to later. You can also travel domestically without the pre-travel testing and quarantining. And in many cases, even if you're exposed to someone who's positive, you can avoid quarantine. That, of course, would be decided by the Department of Health. But for a lot of employers, it's very detrimental to our business efforts if every month, a number of your employees get quarantined because of an exposure that occurred outside of work. Now, if your employees get vaccinated, they may be eligible to just return to work without quarantine. And then, we have a number of events that are going to be happening. So high school graduations, and many of these events, especially if they meet certain criteria, are going to require either vaccination and evidence of vaccination, or if somebody chooses not to be vaccinated, then they have to have a negative test within a certain period of time before that event. And then maybe most importantly, what changes is that that you're doing your part to help end this pandemic. And then finally, and maybe last but not least, people say this all the time, I'm sick and tired of the pandemic. I don't want to hear anything more about COVID, about variants, testing, quarantine, and shutdowns. What can I do? And that's simple. Get vaccinated. So that's my presentation.
Any questions for Dr. Williams? Mr. Akers.
So Dr. Williams, we're talking about basically with vaccination, we would be immune, and we also can't transmit. We're unlikely to transmit. So my argument would be that the CDC is continuing to say that we need to mask even though you're vaccinated. And I think for those that are unvaccinated, the idea that you can go running around without a mask would be incentive to get vaccinated. So therefore, those that are unvaccinated don't see the incentive to actually go through and get the shot. I've heard it from individuals here in St. Lawrence County. So I think it's a mixed message from the CDC. On Friday, you heard a week ago, you had about the CDC director talking about impending doom. And then on Sunday or Monday, it was, well, you could go around without a mask and you don't transmit. So it's a mixed message. And so for the people that are out there, I think the incentive would be that if you got vaccinated, that you could travel and be with people without a mask.
So was that a question or a statement or both?
It's kind of both.
Okay. So first of all, I think, as certainly we don't dictate what the CDC says. I agree. I think the more people see the advantages of vaccination, the more attractive vaccination will become. I will put in another plug for getting vaccinated in that the more people, the larger number of people who get vaccinated, or the higher percentage of people who get vaccinated, makes it more likely that you can safely take your mask off. So I think one of the things that maybe has not been said clearly by the CDC is that if we get to a certain point where enough people get vaccinated, they might suggest that vaccinated people can then go out without masks on. So I'll mention that. But I agree. I think there needs to be an understanding of what the advantages are of vaccination. Again, I would argue that the fact that you yourself are unlikely to become sick, hospitalized, or die should be a motivator. I think personally that, the sort of social responsibility of, even if you're not necessarily vulnerable yourself, at least the way I was raised, if I could do something and maybe even make a minor sacrifice to help other people, I would do it. And I would just suggest that people in our community sort of think along those lines if they're on the fence about whether to get vaccinated. Maybe you're getting vaccinated to protect your grandparent or somebody else's grandparent. And I would frame it in that way.
All set?
Yep, thank you.
Mr. Forsyth?
Thank you, Mr. Chair. Dr. Williams, that sends a mixed message to me. You just said that the Pfizer is 6 months. We'll have to redo it. Have to get another booster shot in 6 months. It's been 4 months of continuous vaccination. We've probably got 35-40% of the population done in the U.S. It'll be another couple months anyways. So 6 months down, and then we got to go through this all again. So do you realistically see a vision of masks coming off ever based on that 6 month number?
So let me just clarify, and I apologize if I wasn't clear about this. So all I said is that Pfizer and Moderna have confirmed that antibodies are still fully present at completely protective levels at 6 months. They're going to remeasure this at 9 months and at 12 months. So the 6 months is just because these vaccines are relatively new, they have data up to the 6 month point. But I want to be really clear about this. They may remeasure at 9 months and say, great news, everyone still has protection. They may remeasure at 1 year and say, great news, we still have protection. So just to be clear, the 6 months is we know for sure that immunity lasts at least 6 months. It may last for 9 months. It may last for a year. It could last for longer. So the 6 months is that's just an honest presentation of the data that we have. I personally think it's going to stretch out. I mean, I hope it's going to stretch out to like a year, but it could stretch out to longer.
And I hope they're doing a study at the same level on the natural antibodies, someone that gets it asymptomatic. And is there any indication how long they're lasting?
There is. So people are doing studies on both immunity after vaccination, but also immunity after natural infection. And I have to tell you that one of the concerning things about immunity after natural infection is that we are seeing people who become reinfected. And I can tell you that, even within our county, we see that where people were infected after a 3 month, then people with immunity from natural infection do get reinfected. It's variable.
Are you seeing that as an asymptomatic? I'm sorry. Go ahead.
No, I was just saying. So,
from the asymptomatic individuals or the people who are really sick getting really sick again?
We're seeing it with people who most of the people are getting tested because they're sick. Okay. But it's a combination. I mean, and some people are asymptomatic and had to get tested for like a work-related thing,
Yeah.
they show evidence of reinfection. But we are seeing people who become sick essentially a second time after natural infection.
Okay.
And that may be related to variants.
Yeah. Okay. Thank you very much, Doc.
Was I clear about the 6-month thing? Because I think that's very important.
You were, because that really concerned me, is that by the time we get 6 months, maybe we'll get up to 100%. We probably won't, but then we're gonna have to redo it again, and that just
Yeah, no, we're
seems like it'll go on forever. So. No, I'm good. Thank you.
Are there any other questions? Mr. Reagan?
Just more of a statement than a question. I think that the fact that 48.6% of the county's population has had at least one shot and 39% have had the full dose is a terrific testament to the efforts of the professionals and volunteers who've worked so hard to get people vaccinated. And I think it's something that we really need to emphasize more of on our website. You know, when you look at the COVID pages on the public health website, you know, we focus on how many people at one time or another have had cases, how many are in the hospital, how many are sick, how many current cases there are in our towns and villages. And the reality is that we are winning this fight. Over half of our eligible population, or almost half of our eligible population, have had at least one shot. And if you've had one shot in a couple of weeks, you're going to have the second shot. 39.5% have had the full dose. We can see the light at the end of the tunnel, and it's not a locomotive heading for us. So I think, we should start focusing on the good news and realize that all of the sacrifices and all of the efforts that have been made by so many for so long are bearing fruit, and that, we as a county can, if we all buckle down and encourage those who have not yet gotten their vaccinations to step up and get their vaccinations to make it safer for everyone, we can lick this thing.
So, anyone else? Well, Jolene, Dr. Williams, thank you very much for your presentation, and we'll see you next time.
You're welcome. Good evening.
Moving on to the agenda, the Chamber of Commerce annual presentation by Brooke Rouse is next. Brooke, are you on?
I am, and I just shared my screen. Are you all able to see it?
Yes, we are.
All right, great. And I'm going to hand it over to Ben Dixon, our new executive director, to introduce himself before I get started.
Great. Thank you, Brooke. And thank you all for having us join you today. Really pleased that I have an opportunity to connect with you all this evening, given that, I'm new to the position. As Brooke said, my name is Ben Dixon. I'm the new executive director at the St. Lawrence County Chamber of Commerce. I started on February 1st. I do know some of you already from my prior 14 plus years of doing economic development work in the county and region, but for those who aren't familiar with me, it's great to make a, albeit electronic connection here this evening. I'm just going to give a little bit of background here, a brief picture of the changes that have happened for the chamber and its priorities over the last year plus. simply as background to Brooke's presentation on tourism matters, which is obviously the meat of the agenda item. So firstly, COVID obviously had a major impact on businesses across the county, and the chamber is no exception. As you know, we're well known for our event programming, in-person event programming, which had to be curtailed when the pandemic started. And so we had to make some difficult choices in order to remain viable and be able to deliver the critical services that the county's businesses needed probably more than ever. So we did have some office restructuring to do to address the changes that we're facing and meet revised priorities. Because we could not do the in-person events that were such a major part of our portfolio, we did have to release our 2 event staff, Joanne and Johnny. At about the same time, our assistant director, Mike Besaw, moved on to a new career opportunity. So as a result, we very quickly went from 6 staff down to 3. But as a result, we had the capacity to create a director of tourism position to realize greater focus and gains in that priority area. And as you know, Brooke moved into that position as tourism is her area of expertise and her passion. And then, of course, the board brought me on to take on the executive director role. And I'm thrilled to be working with this now office of 4. Brooke and myself are joined by Suzanne Cassidy, who is our insurance agent and membership administrator, and Regina Caswell, who is our office manager and bookkeeper. I would note, though, that Suzanne Cassidy is retiring at the end of June, which will be a huge loss of our institutional knowledge, as she's been here for 20 years. So the other thing we did to kind of help us stay viable is we were able to secure some federal relief funds to help us with our cash flow in the year ahead and our financial stability. So that's how the changes in our office went about. But the pandemic also required some transition on our activities and our priorities. Helping our county businesses to stay in business and remain strong and safe became our highest priority. So sharing information about COVID in all aspects, be it safe business practices or the sometimes confusing reopening guidance, testing, vaccine eligibility and opportunities, the also sometimes very confusing relief funding programs that are out there. We had to take all that information and be able to provide it to our business community in an understandable and actionable format so that they could, remain vital in this pandemic. I would say it was really our partnership with county entities that enabled us to do that very well. We, as part of the St. Lawrence County Reopening Task Force, for instance, we've been working with the county government. We've been working with the Public Health Department, the IDA, the SBDC, Cornell Cooperative Extension, to be able to assimilate all those programs and information and resources and then execute our role in bringing it to the business community. So I do want to thank the county for inviting us to be on that reopening task force. I think it's been a very good team that's been doing that, and we are, very grateful to have been part of it. The other aspect of changes in our activities and priorities through the year that's interesting is that a lot of the business support work that we normally do anyway really came to light during the pandemic because it became even more relevant and members were engaging more in those opportunities that we were offering because they really had to in order to keep going. Things like e-commerce, marketing, social media, customer service, and other creative ways of doing business, things that go beyond just, the business as usual model. And the community really stepped up. We always have encouraged local procurement, but our strategies this year were much more proactively structured and enabled the community to step up and support their local business community, and it really made a big difference. my hope is that as we continue reopening, the businesses will continue to adopt these new approaches to doing business that are beneficial, even if there was not a pandemic. So I'm hoping that as we continue to reopen, that's the case. I'm not going to go into a lot of detail at this point in time about the specific activities and programs that we have been delivering because of the time constraints, and also because I know Legislator Haggard has been sharing that information to you regularly as our liaison, and I want to thank Legislator Haggard for doing that. We very much appreciate it. Going forward, some priorities. COVID is still with us, so we do need to maintain these business support services that we've been advancing during the pandemic, and we need to continue those partnerships. In addition, while we're doing that, we'll add in additional opportunities to promote commerce and networking for our members and our county businesses. And of course, as we return to more intrastate and interstate travel, we'll of course advance an aggressive tourism agenda, but I'm going to let Brooke speak to that. One last thing I'll mention about the effects of the pandemic relative to the chamber is our impacts on membership. We did lose some members. From the start of the pandemic to now, we dropped 90 members out of our 412 members that we had at the start of the pandemic. However, some of those individuals have returned, and we have also gained 37 new members over the course of that time frame. 17 of them came on board in 2020, and we've already gotten 20 new members just since the start of 2021. So we are really seeing a good number of members coming forward, and hopefully that's because they recognize the value that we are trying to provide during these challenging times for small business. So our net change really is that we're down 33 members as of today. Since before the pandemic, we're now at 379 members, but new members have, as I said, been coming in very strong this year, and we hope to recover our membership over the rest of the year. So anyway, I hope that just provides a little helpful background as we move into discussing tourism. If you do have any more questions, especially if you want to know more about the activities and programming that we provide through the chamber and that we've been providing during the pandemic, please do not hesitate to contact me. We're thrilled to engage with you in conversation of those matters. My email is ben@slcchamber.org, and you can of course call our office at 315-386-4000. So with that, I will hand things over to Brooke. And it's great to see you all tonight. Thank you for having me.
Anytime you're ready, Brooke.
All right, thank you, Ben. Glad to have Ben introduce himself to all of you. And it's been nice to have this transition and be able to focus even more on tourism just in the last couple months. So the year is looking good ahead. I just wanted to, I did send some materials ahead of time. I'm not really going to address them directly, but feel free to get in touch with me about those or ask questions at the end about anything that I sent ahead of time. But I did want to hit on some highlights, or in the case of this slide, some lowlights. But I'm not sure if you've seen this. The Treasurer's Office shared this with us, which was really interesting, but just wanted to point out, especially the first 2 quarters of 2020 in occupancy tax, you can see that we started off 2020 in really good shape, higher than ever for a first quarter, and then very quickly took a huge dive in that second quarter when things shut down. You can then see that in the third and fourth quarter, things rebounded quite well, not up to 2019, but pretty well throughout the summer and then fall. So I just wanted to share that with you. I think it's an interesting visual, and we hope to continue to be able to look at those quarterly trends, COVID or no COVID. Also,
Brooke, are we supposed to be seeing something? We're not seeing your screen.
You got a question? That was my question.
Yeah.
Okay, I wasn't seeing.
Thank you. How's that?
It's coming.
There it is.
There you go.
There it is.
There you go. Now you can see, so I'll give that another second. I also want to let you know, I've talked about the desire for data over the years, and this year very excited to be partnering with both of our regional partners in the Adirondacks and the Thousand Islands region on some cooperative buy-in to data. So we'll be getting data from all the rooms, which shows VRBO and Airbnb data very specifically. And then we also have a contract with Rove Mobile, which will provide mobile data on specific points of interest and the trends and movement of visitors from that data. So we're just getting trained on all those dashboards, and I hope to be able to provide you with more regular data this year, and data that we can be using to fine tune our marketing plans. Just another point from all the rooms data that I pulled, we did see an increase in the supply over the summer in 2020. So more properties were being offered than in 2019 during the summer of 2020. So more people, you probably saw this, were taking the opportunity to rent their homes. And then in the fall of 2020, we saw that there were even lower. So I think that probably reflects the folks not renting to the college markets during the fall. And so they took the properties off for the fall. So that was another bit of interesting information. And this data from all the rooms also shows an average that we have an average of 149 properties listed on VRBO, and an average of 192 listed on Airbnb. Some of those properties are cross registered. They have listings on both accounts. Just some interesting stats on vacation rentals as well. So although lodging was down, outdoor recreation was up. Those of you know, we launched the stlctrails.com site a few years ago, and it was good timing for COVID. We really saw a lot of local people getting out, which I think was a mental health assist as well for people to find something to do locally in a healthy way. But we also saw increased traffic on the site from Albany, Syracuse, Saratoga Springs, Watertown, and Rochester. So we were really looking at those state markets, day trips, and within state travel throughout 2020 and certainly going into 2021 as well. So you can see just a huge increase in use on this site. So we'll continue to boost that. The other thing with having increase in local residents use it is that those folks are now better ambassadors for our assets here. They can speak to it, they can share their photos, and they can encourage people to come and then help them get around. So that was a silver lining, I guess. So for 2021, we're looking at some different trends for our marketing. We're anticipating, and these are kind of state trends, and national in a lot of cases, that older people will be traveling more. They're the first to get vaccinated. They're also typically the ones that stayed home more, stayed away from family, didn't travel, and they are raring to go. So we're definitely keeping them in mind as we design itineraries and market. Day trips and drive markets, we still expect will be very popular. Some are still hesitant for overnights, so we will encourage those, although we would prefer overnights. And looking not so much at larger group travel, but at independent itineraries, self-guided tours, and small groups visiting the county. And of course, outdoor adventure will still remain very popular this summer. So I shared the marketing plan with you that stays somewhat similar from year to year. The strategies are similar, but the execution changes based on different trends and tools and opportunities really that we see. I just shared this one page, which is an advertorial that is in a magazine that was inserted into the Wall Street Journal. So sometimes we get the opportunity for these great opportunities at the last minute, and we can produce very quickly, high quality, and so we get good deals on great exposure. So that's just an example of one of the techniques that we use. So what's new? There's always something new, and again, there's so much going on, but we'll just hit some things. Hopefully, you all received the new visitor relocation guide that we put out a few months ago. It's also available in a digital format. We hope you'll include that link in your signature or your websites or anytime you're communicating with people. It turned out really well. It was a labor of love. I produced most of the content myself. And the IDA fortunately launched their site this year and had a lot of great relocation data that we were able to just pull right into this. So it's a really nice publication. I'm proud of it. I hope you all enjoy it and definitely provide any feedback. We'll probably be doing updates and a reprint already pretty soon. We also have a waterfall guide that is a new reprint that is ready to go. We're just waiting on the Trails Challenge to be finalized, and that'll be ready to print. And then we hope to produce the Hunt Fish Ride guide that would replace the Angler's Guide we've had in the past. So we'll be developing content for that as well. The end of December 2019, we relaunched Visit STLC with a new design, and we spent a lot of time and energy since then through 2020 updating and working on navigation for this. We work with Komodo Media, which is out of Ogdensburg. She does a great job, and just have some new features on the site, really bringing attention to our built assets in this case on our homepage, and helping people to identify businesses, things to do, those itineraries, the events, and access those brochures in a digital format. We also launched a new blog, and that will be increasing in content this summer. So everything from day trip itineraries to specialty experiences for niche markets like birding, alternative health, things like that. Anyone who wants to be a guest blogger is welcome to get in touch. And then we also added a feature on local communities. So each of these communities have a landing page now, and it's integrated with events and businesses so that once you're into this page, it automatically pulls by town the events and businesses that are closest to that town. So it helps people to start to navigate from something they're familiar with and then branch out around the county. So that was Visit STLC. We have a few websites. STLC Trails, I've already presented on this, so I'll be brief on it, but for those who haven't seen the number of different experiences here, and ability to search by several different means. We've been working also this year to really build out this site, add more trails, and that's an ongoing effort. It also geo-targets businesses near the trails, really important to connect the economy to the outdoor experience. But new just this month, now you're able to create an account and earn virtual badges on the site. So we just have a few simple ones and then some that are a little bit more challenging up there now. This is once we invested in building this out, now it's out there and available. So if any community wanted to create a badge challenge, or any group, any school, anything like that, the technology is now in place, and we just select the trails and make it live. So that's a fun new feature that we hope will increase engagement from locals and visitors. And this is you're seeing first. So coming soon in May, we will be ready to launch the Great 8 Challenges. So there are 3 that we've identified, and within each of these challenges, there are 8 distinct trails. So the Riverside Run features trails where you are essentially going along the trail or along the river the whole time, or most of the time, and we'll also be promoting it as a trail running experience, but it's also just good for walking. Nature Nuts highlights 8 interpretive nature trails that exist in the county, and the Waterfall Crawl features 8 waterfalls in the county. So we're building this out right now. We've been working with the DEC and the Ranger School in Wanakena to get some baseline monitoring on some of these trails so that we see what the potential impact is before launch. And now we're working on just communicating with property owners to let them know that this is ready to go, and we'll have the ability on our e-commerce site, Shop STLC, that will link to this, where people will be able to purchase the badge, patch, or sticker. So really excited about this. This has been in the hopper for over a year. So I'm excited to launch this, and we hope everyone will embrace and share this opportunity. And this is just an ad that has just two back page, full page ads that have just gone out that will be published in May. So this is the way that we'll be promoting this sort of opportunity to come here. And I hope everyone recognizes that these challenges are very hot and attract people from all over. And in our case, they have a lot to experience, and to get a badge, they need to get 8 trails done. So they'll have to stay at least a long weekend. The other thing new is that we have a TikTok channel, also very new, so not a lot of followers yet. I included our hashtags and our tags there. So if you're on TikTok or any of social media, definitely tag us, follow us, and help us to grow that platform as well. I believe this is the last highlight. We are a member of the New York State Tourism Industry Association, which is an independent membership organization that works in collaboration with the state, but is separate. And NISTIA has created a campaign called Roam the Empire, which is launching soon. And the idea is essentially to encourage New Yorkers to continue to travel New York. We saw a lot of that last year, and so we're trying to continue that loyalty to New York and help people continue to understand how much there is to see and do in New York. This is a cool campaign because just as members, we get access to the marketing assets. We plug in our images and our text, and then we're also working within their brand. So if you see that coming out, it's a cooperative marketing statewide opportunity that you'll see from all over the state, including St. Lawrence County. One of our other sites is fishcap.net, where we're updating all the summer fishing tournaments. This also has a tremendous resource for folks coming to the area to fish and looking by species and different waterways and things like that. So if anyone knows of any tournaments, small or large, let us know, and we'll get those up on the events here, and they can submit it through the contact as well. And that leads me into our bass conversation. Do I want to address any questions on general, or you want me to do it all first? Go for it.
Any questions? Mr. Smithers.
Yes, it's troublesome to many about the travel between Canada and our county. How are things looking there as far as the possibilities go? Can we do anything to pursue allowing travel for those people that can show that they've been vaccinated or have a negative test between the two countries?
I'm not sure. From what I've seen, the situation's getting worse there, especially in the close areas. I was in second degree conversation with someone who said Ottawa, for example, is on complete lockdown right now. And so unfortunately, it's not looking good anytime soon. I will say that we did see some interesting trends with the border being closed, that certainly our river saw a lot of activity of people who potentially typically cross the river and experience it from the Canadian side. So there were a lot of people traveling up and enjoying this area and state parks here, and extending the season for us into the fall as well, especially along the river in Black Lake for fishing especially. So that was a trend that people thought was potentially because they couldn't cross into Canada. But we're following the Canadian news closely, but I haven't heard any inch of movement on that yet.
Anyone else? No, carry on, Brooke.
No.
Oh. Tony and Dave both have, yeah.
All right, they're not on the screen, so I can't see.
They're on that screen.
They're on your screen.
Okay. Mr. Forsyth, and then Mr. Arquette.
Thank you, Mr. Chair. Thank you, Brooke. My concern is the membership. It looks like it's down about 20% from prior year. 400 even going into 2020, 424 or whatever it was. How is that opposed to like 3, 4, 5 years ago? Is it down? I like what you're doing. I like everything you just showed me, but I'm still concerned with membership.
It's not down that much. We can pull the data. We're just having a conversation internally about the way membership was structured when I arrived. For example, I remember going to the first meeting and they said we have 750 members. So you'd quickly realize that I've done a terrible job in my 6.5 years by dropping hundreds of members. But what we found out was that members were being counted in different ways. So for one, if it was a bank, for example, right now we include the bank as one member, but we list their branches. Before, each branch would have been counted as a member. And so multiply that times Kinney's, times, all the different businesses in our membership that have multiple locations. The other thing is that the bookkeeping was a bit behind, and so people weren't being termed if they hadn't paid. So there were some people who hadn't paid membership in well over a year or two, and they were still included. And so we did a lot of cleanup, and really, we help a lot of people beyond our members, and we try to put our money where our mouth is, or not. We're less salesy and more trying to provide the value and want people to appreciate that and buy in where they can. But we also recognize that there are members who are parts of community chambers, and that may be beneficial. And so it has been, I think in my time, it's been between 375 and 450. We've been above 450 since we cleaned up the records. But I think it's today, Monday, we've had, I think, 3 new members since Friday. So people are starting to really recognize, and it's been consistent, and none of those we had contact, that we know of had contact with. So,
Sure.
so we're not concerned. I don't know, Ben, you want to add anything?
Yeah, I mean, I'll add, obviously I've been at it 2 months, but I think we, at least here in the office and on our board, are feeling good about the current direction of membership. As I mentioned, we've brought on 20 members since the start of January. And as Brooke mentioned, we got 3 more in the last week. And I actually happen to know we have 3 more pending because we have not yet received the payment or board approval or anything. So also our renewal rates are good this year. Our renewal rates are proceeding at a better pace than they were in the last couple of years. So it's our hope that, businesses around the county are recognizing the important role we've been playing in the pandemic, and that we'll continue to see our membership increase. That said, I'll use this as an opportunity to pitch. If any of you know of any businesses who are not St. Lawrence County Chamber members, please have them call 386-4000 so we can get them on board.
Well, and that's interesting, and I appreciate both of you on that. My concern, of course, the numbers being down, but a lot of times the exit, why are the people, and I know with your numbers of employees, it's hard to check on why didn't people renew, but I'm always curious, why don't people renew? And NFIB and the Better Business, all those things, I found over the years, face-to-face or people that at least called you, you were more apt to renew than just sending them a letter because, you know, business owners are busy, COVID ruined everything. You throw it away, you know? So I don't know how you address that with lesser staff, but.
And we are doing now, and have been over the last month, we have a 90-day payment. So we're kind of in that window now. So individual outreach is going out now. And in a lot of cases, they say, oh, shoot, I thought I paid it or I didn't see it or whatever. And we send them the invoice and it's paid. So that's where Ben said the renewals are coming in nicely. We've also seen some businesses close and COVID or just kind of retirement, or we've seen some business transition. So we had a woman in who's been a loyal member for years, and they successfully transitioned their business this month. And so she said, don't you worry, I'll make sure they renew for the lodges up in Chippewa Bay. So again, we feel pretty good, and we do ask them for feedback, and typically it's kind of beyond our control. And last year when they didn't renew because of COVID, we weren't pushy, and and often they said, please call us in January, check back, see how we're doing. And then they renewed at that time. And so they wouldn't be considered new members. We kind of gave them a grace period. We also allowed the opportunity for them to pay monthly versus a year to help with cash flow. And only a few took advantage of that. So I don't think that was the issue, but we're trying to accommodate anything.
Well, thank you. I appreciate it. Keep up the work.
I'll just add one comment to that as well, is that the reasons for numbers going down are obviously varied. It can be, as Brooke mentioned, it could be a death of a business owner. It could be because COVID forced them to shut down. Also, it's important to recognize that we have a tremendous oncoming surge of retiring small business owners at this point in time in the North Country. And that's one of the reasons why we are working with the North Country Center for Businesses in Transition. I'm actually the community liaison to that, to try to help business owners who are looking at retirement in the next 3 to 5 years, help make that happen, help find another entrepreneur to buy the business from them, or transition to a family member, or even transition to an employee ownership model. So that was actually one of my biggest focuses in February, was working on those transitioning businesses, which is, of course, nationally an important trend that we see based on demographics. So I hope that helps give a little perspective.
That's good. Yep, I'm good.
I'll also note our leadership circle is growing. We have a group of members who give substantial donations to the chamber for additional sponsorship and marketing opportunities. It's a major investment in the chamber, anywhere from $1,000 to $5,000 extra dollars. And we have seen several new leadership circle members come in this year. So good positive news there too as well.
Mr. Arquette.
Thank you, Mr. Chairman. And thank you, Brooke and Ben, for your presentation, and welcome aboard, Ben.
Thank you.
About a decade ago, I was, as a legislator in Albany, advocating with the Assembly Transportation Subcommittee for the use of our trail systems. That particular testimony was in regards to motorized recreation. Well, it became very clear to me in that meeting, there was many enviro folks there that opposed any type of motorized recreation, and wanted to actually get adversarial about it. I explained to them right off the bat in St. Lawrence County, we welcome all trail users, motorized or not. We have a big county suited for trail systems, suited for outdoor life, plenty enough room for everyone. And that was 10 years ago. I've continued to advocate for all types of recreation here. My point is that after seeing your presentation and seeing the activities of the chamber over a number of years, what I would like to see is some type of a survey done. And again, it's not to put one user group against another, but it's to try to get a clear picture of the number of, in a usership form, the number of motorized recreational activists and users in this county with both snowmobile, ATV, UTV, in comparison with the usership of the non-motorized. And again, not in any way to discourage all types of userships, but maybe to get the focus a little bit more oriented towards the motorized, because I think being a motorized user myself out there for all of the seasons, seeing the huge numbers of people that are on snowmobiles, on UTVs, ATVs, I'd just like to see a stronger focus from our chamber on that. I think possibly a unbiased survey as to who's out there doing things and spending money would serve our chamber well and their priorities. Thank you.
Thank you.
Mr. Eckmeyer. Anybody that hasn't spoken yet wish to speak? I don't see anybody. I thank you, Brooke and Ben, both for giving us a very good bit of background on what's been done, what's going on, where you're suffering a little bit, but it looks like you've made a turnaround, a significant turnaround, and that hopefully that will continue. And once we get through this COVID, brighter days will be upon us. So thank you very much for your presentation. I'm sure we'll be seeing you, shortly, being budget season coming up. So Ms. Haggard, do you have a question?
Yes, Mr. Chair, thank you. I think Brooke was going to tell us a little bit about Bassmasters. Is that correct, Brooke? You wanted to go on with your presentation a little further?
Yes, thank you.
Yeah.
If you want to, that's
accidentally cutting you off, Brooke. I apologize.
just one slide, but I figure you probably wanted an update. So Bill sends his regrets for not being able to join. He had an obligatory meeting with the town of Oswegatchie tonight, but we were on the phone daily, but again today. And I was on the phone with Eric Lopez from Bass this morning as well. So as you know, hopefully, July 15th through July 18th is the Bass Elite in Waddington. We have a committee that's been meeting now for a couple months, and Chairman Sheridan has been able to attend, and I know Legislator Curran has been on the email list as well. We're still trying to find the best meeting time for everybody, but have been including information in those emails. Can you see my screen again? Okay, thanks for that, Ben. Just so you know, and hopefully you saw the information I sent ahead of time, but we're working on a plan. Obviously, the capacity and guidelines are opening by the day. Again, more guidelines came out today actually on venues increasing capacity. So they are changing by the day and we're trying to keep on top of it. But right now, Bass is working with the safety guidelines provided for professional sports, and they'll have their safety plan together, and we'll be adjusting that as additional guidelines come out. But they are feeling very comfortable going above and beyond New York State guidelines this year for us. We are looking at currently keeping attendance to 200 people at Whitaker Park throughout the 4-day weekend, and having an additional market and different activities downtown in Waddington. We have a few business owners on the committee this year that are helping to plan some additional activities throughout the weekend down there. So at this point, that is what we are working with for the safety plan. However, we're hoping that opens up a little bit more. We are also looking at the guidelines for professional sports with fans, but those are really designed for the larger stadiums and venues, and so it's just might be overkill for this, but essentially you can either have 200 people or you can have thousands of people. And so that's where we're at right now, is just navigating the best choice and the safest choice there. But our goal right now is just to make sure that the county is in support of having the tournament here. I included on this slide just the impact alone from having the tournament. Just the anglers and their crews here for typically a 7-day period, and often they come throughout the summer to train as well. And this is really only including their conservative estimate of their stay for the tournament. So it does have a good impact, just even very conservatively. Any questions on that so far, or feedback? Again, we're trying to navigate best choice. We're in April, we have a couple months, but we really want to be able to make some decisions and move forward with a more specific safety plan.
Does anybody have any questions or comments? I don't see or hear any, Brooke. I won't repeat my spiel, and I apologize for trying to cut you off early. I would like to tell you that I did get a copy of that brochure that you sent out, and it is very well done, very well. Very pleasing, very informative, and I think it really depicts some of the high points here in the county for people to see in the way you presented it. So congratulations on that. Very good. Thank you again for you and Ben both for coming, and it was a very good presentation, and I'm sure we'll be seeing you again shortly.
Thank you. Have a good night, everyone.
Thank you all very much.
Good night. Moving along to community services resolutions. Jay, are you present with us?
I am. Good evening.
All right. The first resolution is a resolution accepting a donation and modifying the 2021 budget for community services to purchase bicycle helmets for the traffic safety program. Moved by Mr. Denisha, seconded by Mr. Akers and Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried. Jay, I should have asked you for any, a little bit of information about this, and I apologize, I got ahead of myself. Would you like to comment on it?
Well, I just wanted to thank the St. Lawrence Federal Credit Union for this donation. I mean, historically, they have given to the traffic safety bike helmet program, so we appreciate it.
All right, thank you. The second resolution is modifying the 2021 budget for community services for funding received from the New York State Oasis to St. Lawrence County as pass-through funding to St. Joe's Rehab Center. Is there a motion by Mr. Smithers, seconded by Ms. Curran and Mr. Denisha? Jay?
Yeah, we received hopefully the last state aid letter that amended the cost of living increase for St. Joe's outpatient services. So this resolution reflects that increase that will subsequently be reflected in the contract.
Okay. Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is modifying the 2021 budget for community services for funding from RFMH Oasis New York State Opioid Response Grant. Moved by Mr. Smithers, seconded by Ms. Curran. Jay?
Yeah, with the help of the treasurer's office, we've been reconciling the SOAR grants. And during that process, we found that one of the salary and fringes that are being funded by SOAR was not correct. So we had to increase the benefits and decrease the salary to make it correct. So we can then subsequently amend the budget with the Research Foundation.
Okay, thank you. Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is modifying the 2021 budget for community services for the co-located program in the Department of Social Services. Is there a motion to move this? By Ms. Curran, seconded by Mr. Smithers. Jay?
Yeah, we have two chemical dependency case aides currently in the co-location program. We are increasing that to have a third person join that team. So, you know, this reflects the changes that are necessary in both the community services budget and Department of Social Services budget. I will say the numbers from 2019 to 2020, the referrals increased by about 100 new additional referrals. In terms of the number of toxicology tests, when compared with 2019, was up 750. And the screenings for substance abuse use also increased by 30 in 2020. And the number that were referred to services as a result of the screening increased by 10.
Any questions or comments for Jay? Seeing none, all in favor? Aye. Opposed? Carried. Moving to the update for the clinic. Okay.
All right. So just, you know, some highlights, so to speak. I mean, the no-show rates, you know, are pretty much hovering around the same, between, you know, 12 and 13%. You know, I will say that there are still other programs that are struggling with no-show rates between high teens and mid 20s. So we're doing fairly well with our no-show rate. The next one over, clinic counselor visit average. I have a correction for that. We dropped a staff member several months ago, so we were still using a denominator of 8, and it should have been 7 counselors on the chemical dependency side. So that would increase that number to 5.24 rather than 4.59. And then likewise, we did increase 1 staff member on our mental health side. So the denominator should have been 5 staff instead of 4 staff. So that will decrease that counselor visit average to 6.7 instead of 7.28. In terms of the overall average, instead of it being 5.49, it is 5.9. In February, it was 5.7, so it is still a slight increase. One of the things that brought it down on the mental health side was we brought on that 5th clinician. And of course, there's always some startup time for them to take on and develop a full caseload. So it's my understanding that that person does have a caseload of 80 already, which is a full caseload. So hopefully those numbers will be reflected in a better light next month. In terms of average weighted face-to-face visits, it's 65.7. It's down from 68.8. I think part of, you know, people canceling and not attending their appointments is some of it has to do with the stimulus checks. It's not always a good thing that people have extra cash when they're struggling with addictions. And I think the weather had a factor in that as well as it warmed up. So, and again, the mental health, it's still meeting the production goal. We're at 75.54. We were running in the 80% previously, but again, we brought on that new clinician. So in terms of prescriber visits, the 8384, that is actually a new position. If you recall, we have transitioned away from the locum tenens, and we brought on a local physician assistant to prescribe our mat, to be, be in person if needed, but also to lower our costs in the long run. So again, hopefully her numbers will be reflecting higher next month. In terms of the wait list, says there's 3 for the addiction services. Those 3 are currently being served, so we don't have a wait list. We did at the time that we formulated this report, but that number is 0. The services provided increased to probably about 300 number of services provided, and the individuals served very similar to last month. With regard to paid percentages, we're still running in the high 80s, close to 90% of reimbursement. I don't know if there's any questions or.
I don't see any. No questions or comments, Jay. Thank you very much for your presentation.
So I have one more thing there.
That's right, you do, the telehealth status.
Yeah. So this is kind of more informational. I just want everyone to know that, regardless of the waivers that OASIS and DOH and OMH have in place, and when I mean waivers, during COVID, they're waiving the requirement of having an initial face-to-face initial assessment. That includes with comprehensive assessments on the OMH side, but also induction of Suboxone. They waived that requirement because of COVID. Signing of releases, we can get verbal consent and document that in the chart. That's another waiver. Certified recovery peer advocates have a waiver in place that allows them to do remote services rather than face-to-face in the community contact. Medicare has a waiver in place because of COVID, waiving the face-to-face every 6-month contact in order to continue being paid by Medicare. So whether these waivers remain in place, past COVID, we don't know. But I do want to let the board know that we started doing telehealth on the addiction side back in November of 2018. And that was with the prescribers. And then we brought on in December of 2019, the counselors. And we did that by way of application to OASIS. So regardless of the waivers, we will continue to be able to provide remote services. Likewise, on the mental health side, we applied in April 2019. We started telepsychiatry in July of 2019. And then we subsequently made application right before COVID in March 6th, submitted submissions for the mental health counselors to also be able to provide remote services. So, we are continue to be in good standing. During COVID, remote services are still the preferred method of treatment according to the regulatory agencies. So after the 21st of April, when people come back into the office, certainly we will give client choice as to whether they want to have a face-to-face in-person session, but I suspect that predominantly we will remain remote.
Mr. Akers.
Jay, could you give us an update on the progress of the St. Lawrence Health Systems and the opioid clinic?
Well, it's my understanding that they're still in application with Oasis for their operating certificate. I don't believe that they've started any renovation or construction for the site out at the mall. So it's, I mean, there's some behind the scenes things going on in terms of the application, working with the architect. But the application has not yet been approved by Oasis.
So Jay, do you have a role in that to help speed this up, or are you part of the process, or as far as overseeing that application and making sure it's done in an appropriate time?
Well, I'm trying to keep track of it and, trying to, gently, nudge it along by inquiring in terms of where they're at with application and things like that. We did hire our fiscal manager. That person started today. So that'll be, some more eyes and ears on this project as we move forward to try to get it moving.
Well, I guess my concern is, I know that, and I see John's got his hand up, and he should be concerned, and I am too. St. Lawrence Health Systems gave us, basically, they said that within a year, they would have this program up and running. It concerns me that we're still in the application process. So, thanks.
Yes.
Mr. Burke.
Jay, just to clarify, the ball is in the court of St. Lawrence Health System. Is that correct?
It is. They're doing business as Canton Potsdam Hospital, but yes.
Well, I along with what Kevin said, there needs to be a message. Our community needs the services, and they got a pretty healthy incentive, financial incentive. I think the message should be given that they need to move it along.
Understood.
And not you, Jay. This isn't directed at you by any means.
Ms. Terminelli.
If I could just follow up on what John just asked, Jay, are there date or time specific benchmarks that they have to meet in order to keep this funding, or at some point would they lose it if not been met?
I mean, we have to work with the grants manager from the Office of Justice Programs to keep her, informed in terms of where we're at. And I've just gone through and, just amended the budget and resubmitted that, based on, we found out that we wanted counties to attend the annual meetings down in Washington, D.C. So we had to amend the budget to put that in the county budget and not the St. Lawrence Health Systems budget. So things like that have been ongoing behind the scenes from my end.
I guess more specifically on the state end, with the state, is there a point that if you don't use the funding, they take it back?
Well, I don't know if there's a hard line. I have talked again with the grants manager, and she says a lot of times these 3-year grants frequently go well into the 4th year. So she's not, she's not being, expressing too much concern at this point. But, I do think, we do need to move this along.
Anyone else? Mr. Akers.
Well, Jay, it is the Community Services Board's responsibility to see that services that are needed by the community are provided. And I think that the expectation would be from this board, because it was a close vote as to who would have that service, either St. Lawrence Health Systems or the county were the main 2 contenders. And the decision was made that St. Lawrence Health Systems could provide a full gamut of services. The fact that this is not making any progress really concerns me, and I think that both our representative, Rita Curran, and you yourself should confer with the Community Services Board and initiate some type of action or some type of correspondence with St. Lawrence Health Systems to get this ball rolling. There are people that are in need of these services. The county board has elected to award this to St. Lawrence Health Systems. They need to move on this.
I will follow up.
Mr. Forsythe.
Perhaps we could have the people that made the initial presentation come in and give us an update. And then we'll know where we're at.
All right, thank you. Any further questions or comments? Seeing none, Jay, thank you very much for your presentation and your time. And we'll move next to the Public Health Department, Jolene Munger. And that is in regard to a resolution authorizing the chair to sign contracts for services for the preschool special education program in the Public Health Department. Moved by Mr. Denisha, seconded by Mr. Smithers. Jolene?
Thank you. So this resolution is for our annual contracts for our preschool program at the current rate set by St. Lawrence County.
Any questions or any comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next one is for the Office of the Aging, Andrea Montgomery. And the first resolution is modifying the 2021 budget for the Office of the Aging for New York State Office of the Aging funding from the Consolidated Appropriations Act for St. Lawrence County. Moved by Mr. Denisha, seconded by Mr. Sheridan, Mr. Akers, and Mr. Forsythe. Andrea.
Good evening, everyone. So yes, this is some money that has come through one of the 6 kind of amendments of the CARES Act that will help us with our nutrition program. Because as you can imagine, COVID has hit our older adults very hard, and we've seen record numbers of increases in our clientele. So this money will help us to continue to provide those services to folks.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is proclaiming May as Older Americans Month with the 2021 theme being Communities of Strength. Is there a motion by Mr. Smithers, seconded by Mr. Denisha? Anything you'd like to say about this resolution, Andrea?
Sure. So May is a time where we recognize and honor our older Americans. Normally we get the opportunity to have a wonderful May festival, which is the first Friday in May, as well as our senior award winners are honored at a presentation in Albany. Of course, due to COVID, we are not going to be doing that this year in May, but the state is looking to have a virtual ceremony to honor our award winners in October. And we all look forward to the time when we can safely gather in person to celebrate these amazing people who give back so much. And I think the theme this year, Communities of Strength, given what a horrible year this has been for everyone, but particularly for older adults, given that the COVID virus has had much more fatal complications for them, I think it's a great time for all of us to take a moment to thank the older adults in our communities and do whatever we can to help them. Thank you.
Thank you. Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. Thank you, Andrea. Appreciate your time.
Thank you. I think.
Looks like there's a question, Joe.
I beg your pardon?
Question.
Who has it? Ms. Haggard, you have a question? And Ms. Terminelli, you can have the floor after Ms. Haggard.
Mr. Chair, I don't know if I missed something when we didn't have sound, but did we have Adam Simons coming on for weights and measures, or is that something that was deleted from?
That was withdrawn.
Oh, I'm sorry. I didn't hear that in the beginning. Thank you very much.
Okay. You're welcome. Ms. Terminelli?
That was my question as well, but thank you very much, Andrea, for the May resolution.
Thank you.
Thank you again, Andrea. Moving to the Vacancy Review Committee.
Yes, the Vacancy Review Committee met on April 6th. 16 positions were reviewed, of which you'll see 2 departments on this agenda out of 9 total, 5 departments at operations, and you'll see 2 at the finance agenda. As far as the statistics go for this portion, if you remember, we do this review August to July annually. We are at 109 positions so far. And just as a reminder, separate from COVID year last year, which we dropped to the 130s, we average about 150 to 160 positions, almost identically for the last 5 years in terms of turnover. So monthly, last month I reported to you, we were at about 12.8 positions per month. We're up just slightly this month at 13.62. We're holding pretty steady at an immediate fill rate of 64% this month. Last month it was 66%. Just up slightly in the held 30 days for 16%. And then right on down, very small numbers being held, 60 at 1%, 90 days at 4.5%. So working toward what I believe will be a similar year, probably up a little bit from the COVID year last year, but we'll keep you posted on that. And that being said, the first department to present is Community Services. Jay?
Jay, are you with us?
I'm sorry. Yes, I have a vacancy authorization request to fill a fiscal officer for the Department of Community Services. The fiscal officer that we had for a little over a year, who was commuting back and forth to Watertown, opted to take a job closer to home. So I'm asking for an immediate fill. This person is responsible predominantly for doing the work of the LGU, which is overseeing the distribution of downstream monies to the providers, but then also reviewing their consolidated fiscal reporting that subsequently then gets forwarded on to the state regulatory agencies.
Questions on that? Okay, next one, Jay.
The next vacancy authorization is for a nurse practitioner. We've had a nurse practitioner in this position again for a little over a year and a half. She and her family have decided to move to Arizona. So it's going to be a void that I'm hoping that we can get replaced as soon as possible. We do have several candidates that already expressed interest. They are finishing out their degrees and are not yet licensed, so there will be a 2-month lag. So I haven't discussed this with Ruth, but tentatively, the current nurse practitioner is willing to become a temporary part-time and continue providing prescriptions and provide remote services if need be to help fill the gap. And additionally, we have a physician's assistant who currently is prescribing Suboxone in our MAT program for addiction services, and also provides services in our our physical health clinic. She would also have some available time to increase the amount that she spends with the county to cover this, possibly until the resignation is for June 9th. And I think best case scenario, this candidate that we're looking at would be able to start probably mid-July. So, rather than get a locum tenens back in to the department. We would prefer to try to handle it, I guess you would call internally, to make sure the case load is covered, and that there's not a disruption in the continuity of care.
And I would just like to add, if I could, on this, unless there's questions, this is an area with this fill or anticipated fill that we've been talking about what one of the requirements under some of what you've been hearing about with Family First in social services is going to need in terms of a qualified individual to be available to make assessments. So this may be an area, and this person would be pivotal in that setup, might allow for us to provide a contract between social services and community services to make sure that that service is provided. And hiring someone and potentially contracting with a mental health clinic might be another asset that someone coming in would be able to provide, as well as be provided funding compensation for those services. So that's an area we've started to explore that a little bit. Certainly, depending on Jay ends up hiring. As we know, this has always been a challenging field for us, but I think he has some good options. And I think with the board's support last year, or maybe the end of the year prior, providing those 3 different avenues, that's continuity of care that's necessary when there are departures. So that's another option, I think, that we'll be talking to you more about, but this potential person coming in would be very helpful for that. Any questions? Okay, Jay?
The last vacancy authorization is for a behavioral health clinician for the mental health clinic. And again, that could either be an LMSW or an LC license, an LMHC, excuse me, or an LMSW. So that's why there's 2 position numbers. We're asking for this added position because of having to return to work on the 21st. We have several clinicians that may not be able to return to work or return to work in the same capacity they had been while they were allowed to work at home, either due to childcare reasons and or other personal family health reasons. So right now we do have 5 clinicians, but they are all having a full caseload. And even though we do not have a waiting list right now, if one or both of these individuals is not able to resume the same level of work that they're currently providing for us, we would certainly then develop a wait list. So we're asking to create this position and kind of put it in the queue to see how this moves forward.
Questions?
Mr. Burke?
So Jay, the remote working isn't a viable solution on a long-term basis?
Well, I mean, it's my understanding that everyone has to return to their office. It doesn't necessarily mean that we're going to have a lot of walk-in traffic. I think we're still going to be doing remote services, but the clinicians where they sit is required to be in the office. So that's where the conflict comes with some of the providers, who have some personal issues at home.
Follow up, Jay. I guess I wonder why we wouldn't continue remote. I mean, if is there any detriment to the quality of service?
I think the quality of service has probably increased. Certainly, there's been more engagement and reduced no-shows. And people seem to like this service. I mean, there are a few that may prefer to come in, once allowable to come in and have a face-to-face. I believe the majority will continue to provide, or we will continue to provide remote services because, it takes away some of those barriers like transportation and childcare. So, I know, other organizations are continuing to have their clinicians, work from home. We have our electronic health record and we can track whether or not clinicians, are doing their work or they're not. So it's not like we're running blind with being able to supervise them and to know when they need more supervision.
Well,
Anyone else? I'm sorry. Go ahead, John.
I was just going to ask if that would be something that that we could talk about at a future point in time. I don't know what Ruth's position is on that, but I think we've learned some things from COVID, and I wonder if this is one of them. I mean, we certainly learned from the Auctions International that having remote bidding served the county very well. And again, I don't know whether this is good or bad, but I don't think we should just brush it off without talking about it at some point.
If I may, I will say, there is a risk of losing clinicians when other agencies, allow them to work from home, which, for some of them, that's preferable.
Mr. Akers.
I think Ruth would like to comment. That was what my question was going to ask her to comment also.
Certainly, Mr. Burke, that is certainly something we can discuss at a future meeting. I think there is some interest in not, losing, as you suggested with your example about Auctions International, some of the things that we were able to learn. And I would say that we are interested in discussing the options associated with remote work and coming to an agreement on how that would be carried out. So certainly we can do that in the future. But we're going to go ahead and bring everybody back this coming Wednesday. So I'll get in touch with you on that as well, John.
Okay. Mr. Akers.
Then for follow-up, so in the event that these two individuals that Jay was speaking about opt not to return to in-house work, but continue to do work from home or some capacity, at what level do they lose their benefits? For example, for healthcare benefits or something else? Ruth.
Can I answer that? Yes, ma'am. So at this option, or at this point, as of Wednesday, there's not going to be an opportunity to remote work any longer. So what Jay's speaking to is a consideration for what they'll be doing in an abbreviated manner. And so his concern, and I think wisely so, coming to vacancy to talk about if they're only able to work 2 days, 3 days, 4 days, whatever it works out to be, and there's a federal benefit allowing that to occur until September, how will he make up the patient care in the meantime? And so in those conversations, bringing someone forward or beginning that process, as you know, that's a challenge for us as well, that allows him the time to get started if in fact he needs to bring someone in to pick up the balance. And so that's his interest.
Is this the only department that's actually making these or asking for this allowance now, or will there be others?
There will be others, I'm certain. But there are, without the remote work option that we had discussed, I think that we're going to see how the return, the transition occurs this week. And then that's a matter that HR will handle individually with the employees, and the department heads will be assessing as the impact on operations.
Okay, thank you very much.
Mm-hmm.
Ms. Haggard.
I'm going to make thank you, Mr. Chair. I'm going to make a couple of assumptions that may or may not be correct, but one thing I do know is that women were disproportionately affected by the lack of childcare during the pandemic and lost their jobs at a greater rate than men did during the pandemic nationally. And I'm assuming, and this could be incorrect, that if these counselors are women and can't provide childcare, that we should be, as everyone is suggesting, particularly cognizant of the fact that this has become a huge problem for women in the workplace, and fewer women are employed now than ever in probably the last 20 or 30 years because of the lack of childcare. And we have a lack of childcare in our county in general. It's a huge problem. So I hope that we can all come together and figure out if this is a dad who takes care of their kids, it's the same thing. Children need to be cared for. And if somebody can do their job just as effectively from home, I would really encourage us to consider this. Thank you.
Mr. Manelli.
Thank you, Mr. Chairman. I guess if working from home is not a viable solution, if that doesn't end up being viable, I'm just wondering at the tune of $88,000, if this position, if this is a response to what's hopefully a temporary situation, would it be more, I don't know, would it be more fitting, I guess, if the position was a temporary position as opposed to being permanent? Was that option considered, I guess, to have it as a temporary position as opposed to permanent, if it is a response to a temporary situation?
And certainly Jay can speak to that. Nicole, I think part of the concern was the ability to recruit someone on a temporary basis. And I think, potentially with other organizations allowing that remote work, it may be that much more difficult. But I think bringing it forward with the expectation that that may take some time also. We may be able to figure out if a temporary would work or if a permanent is the right solution. Jay, anything you want to add on that?
No, I agree. It's difficult enough because of the workforce shortage to hire someone on a permanent basis. It'd be difficult to expect someone to leave their current employer and come over here for a temporary position, particularly with this type of employee.
Mr. Reagan.
Mr. Chair, if I could direct this to the county administrator and to Jay, if I'm understanding this correctly, it's we, as in the board and the administration, who are requiring that these providers report to the office for work, and we may lose them by doing that. And then we may have a severe problem recruiting new providers. And as we've seen in the past, the cost of, first off, is that correct?
That is correct. We're bringing employees back.
Jay?
Yes.
And is it my understanding that you're saying that the current system is working well?
Yes, it has been working well.
So I understand the issue of fairness to the rest of the workforce, but at the same time, I'm concerned if we lose valuable employees and end up having to hire local temps at a tremendously higher cost. I don't know whether we will have done ourselves a big favor. I think that we ought to, right now, give the community services director the option to provide services in the way that he finds is most effective until we get through the situation with the schools and all these other outside factors that are creating and compounding the childcare problems that a lot of families are having before we lose some providers that we may not be able to replace very easily. Is that, or do I need to make that into a motion?
If you want to have it considered, you're going to have to make it a motion.
I would like to make that a motion.
Will you restate it, please?
That we direct the community services director to manage his department in terms of telehealth services as he feels best serves the people of St. Lawrence County.
Is there a second? Are you seconding it, Ms. Curran, or do you want to? You are seconding it. Okay, if there is a second. Discussion, County Attorney?
Thank you. Before we move forward with this resolution, if we could discuss this matter in executive session, it would be greatly appreciated.
Mr. Arquette?
Thank you, Mr. Chairman. I agree with Attorney Button that probably should be discussed there. But before that, it's just my feeling that we're all under the restraints of collective bargaining agreements, as we all know, and the leadership of the unions are going to want to keep everything fair and equitable. I think this is a unique time where the scope of work that is being performed has to become a priority in this situation. But I'm certain the county attorney is going to make sure that we're aware of our obligations under the collective bargaining agreements. Thank you.
So unless there's an objection, I would move this to executive session.
I was just going to withdraw the resolution.
I don't think you need to withdraw it. I think we can
Put it
discuss it.
aside, however
Okay.
the chair wishes.
All right.
Thank you.
If you want to withdraw it, though, that's up to you.
No, I mean, I think, we can discuss an executive session here, whatever there is to hear, then the board can act as it feels.
All right, so I've
best.
got Ms. Curran and Mr. Burke, two to speak. Ms. Curran?
I will speak for Rita. Can you speak? She asked, she's not able to speak. She wanted to know, why can we not have a variance with this due to COVID ongoing and the need for social distancing? Are providers not exempt?
Well, this is different. I don't quite know what's going on here.
I'm more than happy to answer that question in executive session.
Wait a minute.
I read a question for Legislator Curran.
Okay. And we're looking for a
And Steve-
response.
Steve-
Now we have some responses.
Steve said he will answer that in executive.
She what?
Steve said he would answer that in executive session.
All right. Why
That's
don't we,
okay.
wait a minute, John. Why don't we take and put this whole ball of wax with regard to this into executive session and get through the rest of the agenda. We will be able to discuss that in detail and in a different venue. Unless somebody disagrees with that, that's the way that I would move this. John, is that all right with you?
Well, if I could just quickly say, Joe, just
ahead.
quick. There is another element to this too, and it's especially for mental health patients. And I think Jay could speak to this, but it's critical to have continuity of care. It's important in any healthcare, but especially important in mental health. So if we can avoid any kind of a break in that continuity, I think it's extremely important to the people we serve. So that's all I wanted to say.
Great. And I think in executive session, we could hear from Jay, we could hear from the county administrator and the county attorney for their input. And then, if we see fit, when we return to open session, we can deal with it. Is that all right?
Yep.
I see nobody disagreeing. Moving along, Public Health Director?
Yes, Jolene should be with us.
Jolene?
There she is. Jolene, go ahead.
Hi, so our first vacancy is due to a retirement. It is the public health program aide, and this position is necessary for our department. They assist with the preventative program work. So they compile data for statistical reports related to immunization, lead, communicable disease, and rabies. And they assist with all of our clinics, including immunization, STI, and rabies clinics. They also meet the data entry deadlines for reporting sensitive confidential information to the New York State Department of Health. They are the main point of contact with the school nurses and physician offices for the mandated immunization quality improvement visits, along with helping out with the COVID-19 response, doing case contact tracing, case investigative type work, and vaccine administration.
Questions for Jolene? Okay, next one.
So the next one is due to a resignation. It is a senior account clerk, and we are asking to fill it immediately. The senior account clerk has many fiscal responsibilities, including assisting with tracking and processing of rabies post-exposure treatment fees, weekly deposits, biweekly payroll processing, our early intervention and immunization program billing, and the processing of grant budgets and vouchers. Currently, they are also responsible for many COVID-19 activities, including helping track all of our COVID-19 expenses and contact tracing and workplace exposures.
Questions on that for Jolene? Okay, thank you, Jolene.
Thank you.
Okay, moving on to committee reports, Board of Health, Legislator Akers.
We'll be meeting tomorrow night to discuss the end of COVID.
What time is that? Is that at 5
6
o'clock?
o'clock.
6 o'clock.
You're gonna ask COVID.
Okay, thank you. Mr. Sheridan, the CDP Board of Directors.
Thank you, Mr. Chairman. Community Development Program Board of Directors met on the 17th of March. And overall, they're doing quite well. Their agency remains financially stable. Their age, what? Can you hear me?
Go ahead, Bill.
Yes.
And the agency remains closed to the public. We have to, they have drop boxes though for program participants outside both doors at their main office location. And their staff is back to 100% capacity. Their Head Start program is continuing to recruit for both the current and upcoming school year. And that program serves the eligible 3 to 5 year olds and their families. And Head Start has a center-based locations across the county as well as home-based options. So they have, they've also had virtual options this year due to the pandemic. And Head Start is stable, and they anticipate another allotment of funds to assist with the COVID-related expenses. Their Housing Choice Voucher Program is continuing to draw from their wait list to fill the Section 8 housing vouchers. For someone to join the wait list, they can find their applications on CDP website or call the main office, and an application will be mailed to them. Their weatherization funds are anticipated to increase in the upcoming fiscal year, and the number of projects to be completed are also anticipated to increase. Excuse me. And they're currently working on a final budget and contract approvals for the year, the contract year 2021 to 2022. And the neighborhood centers are funded primarily through the Community Services Block Grant, and they're financially stable as well. They're continuing to provide monthly food boxes to the participants in need, and they're continuing to see a decrease in the amount of people utilizing the food pantry compared to previous years. And the neighborhood centers offer financial assistance to their communities as well, including utility assistance, rental assistance, employment, educational expenses. And they are currently focusing on financially eligible households who have been affected by the pandemic. So to qualify for the neighborhood center services, a household must be 200% of the federal poverty level or below. And so requests for financial assistance have increased in the past 2 months or few months. And 2 of their neighborhood centers locations have thrift stores, and they're hoping to reopen them in May. And they're currently watching the county COVID case numbers to see if there's going to be another spike after recent after the recent spring break. And then they'll be making the determination at that point on whether or not they're going to be reopen in May. In the next 2 weeks, they'll be making that decision. That's it.
Thank you, Mr. Sheridan.
Legislator Kern mentioned she'll update it finance on Community Services
Okay,
Board.
we will skip over the Community Services Board. We'll move to the Office for the Aging Advisory Board, Mr. Denisha.
Thank you, Mr. Chairman. As Andrea said, there will not be a May Fest this year to recognize and celebrate seniors. Office for the Aging, we did have our last meeting on Monday, April 12th at 10 o'clock. It was via Zoom. Our interim director for St. Lawrence County Public Health, Jolene Munger, gave a really great presentation regarding COVID-19, vaccinations, and took questions if anyone had any. The Office for the Aging still has 2 unfilled vacancies, part-time for the nutrition. I think we can thank the extended unemployment benefits for that. Just my opinion. Next meeting is Monday, June 14th at 10 a.m. via Zoom.
Thank you, Mr. Denisha. The Youth Advisory Board, Mr. Rinaldi.
Yes, sir. Thank you. So to start with, our resource allocation plan has been approved by OCFS, and the board is collecting the annual assessments for all the youth development programs in the county. Youth Committee, Drew Demers, he's one of our seniors that's a member of the Youth Committee. He is going to be doing a virtual workshop. I believe that you received an email with information about it. It's titled Reducing Your Carbon Footprint in St. Lawrence County, and that will be held virtually on Thursday, April 29th at 7 p.m. There's information on both the Youth Bureau Facebook page as well as the county website on that. An update on the partnership between the Youth Bureau and the EMC. Our virtual trash dash is set and ready to go for April 24th and 25th, so this weekend. So we'll be in 5 locations, 3 on Saturday, Potsdam, Canton, and Ogdensburg, and 2 on Sunday, Governor and Messina. Cleaning up the sides of the highway, and this partnership could not have happened. This project couldn't have happened without the help of Adam Simmons from Weights and Measures and Don Chambers from Department. So it's kind of an adopt a highway type of a program. We're looking forward. We have 108 people that are currently scheduled that have registered, and I believe they'll still accept registration forms, but all of the paperwork, the registration paperwork has to be completed ASAP. And I'm sure that they would take on some additional volunteers if any of the board members are willing and want to volunteer at a safety patrol. Our Pen Pal program that I've spoken to you about in the past 2 months, I believe we are currently up to 57 paired Pen Pals. So those letters get exchanged through the Youth Bureau. They're busy reading the letters and passing them to who they go to. We've got some entire classes that are participating. So that's going really, really well. The Connecting St. Lawrence County Youth, the next meeting for that is Tuesday, May 11th, and that's for anybody that's connected in any way to youth programming or in the investment of youth in the county. They'll be focused on summer opportunities for youth. And with that said, the youth summer program application for anybody that's interested in youth programming through the One Stop, you have to contact them directly. They're for some reason not able to put it online, but I didn't know if, Ruth, that's something that we can host on the St. Lawrence County website. I'm not sure why they can't get it online. And then our first newsletter for the Youth Bureau came out on April 1st. So the first week of every month, we'll be able to get a newsletter about all the great stuff that's going on. So you can look forward to seeing that in your inbox. And then we have a Youth Bureau needs assessment that's being conducted May 3rd through the 21st. Next Youth Committee meeting is this Wednesday at 4 o'clock. And the next full Youth Advisory Board meeting will be May 27th at 3.
Thank you very much. Moving to old business. Is there any old business? Seeing none, is there any new business? Seeing none, we have need for executive session for,
This topic, otherwise the executive session typically waits until the
I
next meeting.
understand that.
Just this one.
And we will have the executive session after the operations meeting. Motion to adjourn?
Mr. Chair?
Yes.
We do need to have an executive for the matter discussed in this meeting only.
Right now?
During services. You set the matter aside to be considered in it after
Yes.
executive. So yes,
Yes.
just for that matter, yes, executive session is warranted at this time.
Oh, just
Just for that matter. Yep. We'll do the rest after.
All right. So we have
executive session.
second by Mr. Akers, moved by Mr. Smithers. All in favor?
We're good.
You all set?
Yep.
Okay, we're back in open session. I'd like to recognize Mr. Reagan.
Mr. Chair, I'd like to withdraw that resolution at this time.
Mr. Reagan has indicated he wants to withdraw the resolution. The legislator that seconded that is Legislator Curran. Legislator Curran, do you want to withdraw your second to that resolution? And she is indicating that she does. Thank you very much. There are no further issues coming before this committee at this time. So I'd entertain a motion to adjourn by Mr. Fay, seconded by Mr. Reagan. All in favor?
Aye.
Opposed? Carried. We are adjourned. We will start the operations committee in a couple of minutes. start with that. Call to order the Operations Committee meeting for Monday, April 19th, 2021. And I would ask for a resolution to approve the agenda. By Mr. Denisha, second by Mr. Smithers and Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. I would entertain a motion to approve the minutes of March 8th. Operations Committee. By Mr. Reagan, seconded by Mr. Denisha and Mr. Arquette, Ms. Curran. Any discussion? Seeing none, all in favor? I'm going to vary here from the agenda. Under item 6, planning, we have a gentleman from Jefferson Community College, Mr. Danforth, who's been waiting for hours now to make a presentation to us. Jason, are you with us?
Yes, good evening.
Is Mr. Danforth prepared to make his presentation now, or would you?
Yeah, yes, I believe he is, if that's the pleasure of the board. He is on the Zoom.
Unless there's an objection by anybody here, I would certainly like to see Mr. Danforth heard and allowed to make his presentation now so that he can go about his business. And I don't hear any negativity. So if Mr. Danforth, I'd like to welcome you. I apologize for keeping you in the wings for so long, but it was unavoidable. And I'm certainly looking forward to, and I'm sure everybody else is too, to hearing your presentation. We've heard them before. They're always interesting. So have at it, sir.
Well, thank you very much. I'm just going to share my screen here really quickly. I think you guys should be able to see my screen now, or is it looks okay on my end? I assume you guys can see me. I hope. Okay. Well, again, okay. Yep. Well, thank you for having me, having us, I guess I should say. My two colleagues, Joe Alone and Andy Draper, are watching along via the YouTube feed. So we've been kind of watching your meeting, watching the previous meeting. Again, I just found it very interesting to myself that a lot of the topics that you talked about are things that we have surveyed about in the past 20 years at the Center for Community Studies at JCC. So we've actually done 6 annual studies in your county. We started back in 2015 and we've done an annual survey since. So this will kind of be an overview of the results from our study in 2020. You can kind of see the different topics that we did, a couple of changes that we've made in terms of our methodology and such. But we want to thank you for the time that you've given us tonight. I have made it as brief as I possibly could so that I could give you a general overview. And again, we're always welcome to take more questions that you might have at a later date if you guys have anything you want us to explain any further. So first, one of the important things we always want to make sure that we highlight is that the funding for this is provided by the college, JCC, along with a donation that was made by Car Freshener years ago that we put into an endowment fund, along with some local sponsorships that we got on a yearly basis from the Development Authority of the North Country and the North Country Community Foundation. So with their financial backing, we're able to perform these studies on the annual basis at no cost to the counties. So we conduct these studies in Jefferson County, Lewis, and St. Lawrence County at no cost to you. So the nice thing is that we get to provide this service and hopefully provide you with some interesting information and also useful information. So that's the first thing that we always want to make sure that everyone's aware of is this is something that we can provide to the community at a no cost, just because of the backing that we get from our college and then some of the local organizations that back us as well. So there are basically 3 things that I want to take a look at today. Really, what was in this study? What did we study in 2020? How did we conduct the study in 2020? I mentioned a couple of deviations that we made from our normal practices that came out of the COVID-19 pandemic, some changes that we had to make. And then probably what's most interesting would be what are the findings that we came up with from this study. So first, what did we study in 2020? So you can kind of see on this list that we essentially looked at 8 different topical areas. Every year we study different quality of life indicators. We have a list of about 20 indicators and we rotate them on a 2 to 3 year basis on which ones we're going to take a look at. So we'll take a look at some of the results on just quality of life. The last couple of years, 2019 and 2020, we've looked at some issues that are common topics amongst our society, both at the national level and a local level along the state level. So we analyzed 8 of those. We did a couple of follow-up questions to some COVID-19 information that we collected back in April. We conducted a COVID-19 study about residents' opinions and behaviors in relationship to COVID-19 in all 3 counties in April, and we just did a follow-up on some of those questions when we surveyed most recently. Personal financial situation is something that we like to track on a year-to-year basis, so we track that every year. We simply looked at, what do residents think about the direction of both your county, St. Lawrence County, and the entire country as a whole. We had a series of questions about the St. Lawrence County trail system. We asked a pair of questions about the residents' opinions about growth and or sale of marijuana if it were legalized, which we know at this point it has been. And again, we asked some questions about internet access and how the internet might be being used at this point in terms of employment and learning. So those are the different topical areas that we looked at here in 2020. How do we complete this study? So you can see that we did have to make a couple of changes to our typical survey design and our typical data collection methods. You can see in the bottom right corner, that's one of our previous workers. That's Tony from a couple of years ago. Typically what we do is we take our students from campus. We have a call center in downtown Watertown that we utilize that has 30 different phone lines that we can use to make the telephone calls for our phone part. Well, obviously with the pandemic, we couldn't bring a bunch of students into an enclosed area and practice social distancing. So what we did as a team is we found a way that we could still make it happen. And what we've done is we've taken our call center, we made it remote. So what we've done is you can see a list of, let's see, there's 23 of them there. Mr. Joel Alone and I are up in the top left corner. But what we had students doing when we collected data back in October was they were making phone calls from their homes. So we had them all in a Zoom session, much like we are today. We get to monitor them just like they're looking through. If they have questions, they unmute. We get to talk to people on the other end. So when the people we're surveying have questions, they get a direct contact right with us. The students don't have to run from one room and say, let me go get my supervisor. They literally just hit unmute. And it's something that we've used multiple times. We did the data collection back in October. 2 weeks ago, we actually collect data for the 2021 annual survey in Jefferson County. And we'll be collecting data for the 2021 annual survey in St. Lawrence County in June, so in about 6 weeks. So we'll be back in that remote call center in a couple of weeks to collect data for the 7th annual survey in your county. So I did mention that we collected data at the end of October, which was a deviation from what we typically do in your county. The first 5 years of the study, we collected the data in June. We postponed both the Jefferson County survey and the St. Lawrence County survey this year because of COVID. So again, it was one of those that we didn't think it was appropriate at the time to be asking people about some of these general topics when obviously the pandemic was much higher on the priority list. So we actually postponed and collected data in October. This year we talked to 435, or we collected data from 435 adult residents in the county. You can see it was a mixture of calls on landlines and cell phones along with email invitations that we did online. So it was about a 50-50 split. We had a few more phone call interviews than we did online survey completions. And when all said and done, it came out that we had a margin of error of about plus or minus 5%. So a little bit more than 5%. So any of the statistics that you see here that were answered by, close to the full 435 people, what you want to keep in mind is any number that you see is going to be about approximate plus or minus 5%. So it could be up to 5% higher or 5% lower, but that just kind of gives you an idea of the reliability of the numbers that we're going to present. Okay, so a couple of changes, but very, very similar to what we've done in the past. So the first set of questions that we'll take a look at are the quality of life indicators that we looked at this year. So we picked 7 of our list of 20 to take a look at, ranging from quality environment, policing and crime control, quality of K through 12 education, the overall quality of life in the area, healthcare quality, overall state of the local economy, and the availability of jobs. Okay, so what I've done with the graph on this particular slide is I've actually ranked them from the most positive ratings that we saw in 2020 to the least positive ratings. So what you can see is in this graph, for example, quality environment, it was about 71% of people that rated it either excellent or good. Down to the least positive, which would have been the availability of good jobs, which is down around 12-13%. Okay, so you can kind of see on a relative scale what were the more positively rated items and what were the less positively rated items. Okay, so you can kind of just get an idea of what we saw there. Not uncommon to what we see on a regular basis, that the economic indicators tend to be the less positively viewed items, and the non-economic indicators tend to be the more positively rated. Okay, so not huge deviations there in terms of the relative ranking to where they typically are. On this particular slide, you can kind of get an idea of how did 2020 compare to the previous 5 years of the study. So you can see that a couple of the items are lower than we've seen before. A couple of the items are very, very similar to what we've seen before. So again, it's one of those that we saw one of the more negatively rated items, or one of the least positively rated items were the availability of good jobs, the overall state of local economy. But if you look, the ratings that came in 2020 are not that different than what we've seen over the 6 years of the study. So the 13% of people who rated the availability of good jobs as excellent or good is pretty similar to what we saw from 2015 to 2019. So not huge changes from what we've seen in the last 5 years. Availability of good jobs, we saw it was 52% in 2020. Well, that's a big jump from the 42% we saw in 2019 when you look at the poor rate. But the poor rate was by far the lowest we'd ever seen. Not 2019, we saw it actually drop down to 42. The 52% we saw here is actually very much in line with what we saw the previous 4 years from 2015 to 2018. So you can kind of take a look at the items. A couple other things that we saw some dips in. We saw some dips in healthcare quality. It was the lowest we'd seen. Most of the time, in the other years, it ranged from the high 40s to high 50s. Now it was like the mid 40s. Police and crime control, a little bit lower than what we've seen in a couple of years, but also higher than what we saw in 2016. Quality of K through 12, low 60s. Typically, that's been in the high 60s, low 70s. And the overall quality of life in the area, again, this is kind of similar to what we saw with the availability of good jobs on the poor scale. What we saw for overall quality of life here, we saw it up to 70%. The first time we'd see that in 2019. This year, we saw it drop down to 55%. But if you look, in comparison to the first 4 years of the studies, it is a drop, but it's not as much of a significant drop after we saw that big spike in 2019. So a couple of changes there. Some of them are really polarized because we saw some increases in 2019 compared to where we saw in the first 4 years. Okay. The next couple of slides are just a brief introduction to what you can see if you open the full report. I've sent the full report to Jason, so hopefully you'll have a chance to share that with you at some point in the near future. Every one of the survey questions that we look at, that we analyze, we provide association breakdowns, we provide trend analyses like you saw on the previous slide, and we also provide county comparison analyses if you want to see, well, what do our residents think in comparison to both Lewis County and Jefferson County? So you can just kind of see, we won't take a big, dive look into this, but you can see if you want to see, is there a difference between different genders? Do you want to see if there's a difference based upon people's household income? Is there a difference based upon age and education level and politically? So you can, for any one of the questions in our entire report, in the entire study, you can check and see, are there any of those subgroups that might have different opinions from the other subgroups? Okay, so you do have that ability. And again, as I mentioned, for every question that was asked in all the counties, which in this case, we did the same survey for all three because we surveyed them all at the same time, we've given a county comparison analysis. So you can see 55% of residents in your county believe the overall quality of life in the area is excellent or good, which is a little bit lower than what you see in Jefferson County and even lower than what you see in St. Lawrence County. Some of the indicators in your county are higher, some are lower. And again, that's something that just fluctuates throughout the entire report. Okay, so that's something that is, again, available for every one of the survey questions in this year because we did ask all the questions in all the counties. So you do have that option if you want to dig deeper into the numbers. The second group of questions we took a look at were some just general person opinion issues, some of those societal questions that are common practice that people talk about at a national level, at a local level. So again, what we did is we asked a series of 8 different opposing statements. So what we did is for each one of these topics, we read 2 statements to the participants. And basically what we did is we asked them to indicate whether or not they agreed with statement A or they agreed with statement B. We gave them 2 statements, said, which one do you agree with more? And you can kind of see, again, from an increasing differentiating opinion to a more similar opinion, you can see that the largest difference was people's opinions about same-sex relationships. So you can see from the graph here, about 70% of them of participant or 70% of the residents in the county believe same-sex relationships are all right or okay. About 26% say that they are not okay, that they're wrong. Okay, so not quite a 3-to-1 ratio, but it's a little less than a 3-to-1. And again, the ratios get closer and closer until you get down to the bottom one. The two closest opinions that we saw were people's opinion on whether or not they should build a wall along the US border. Should we build a physical wall? Should we use other methods? And you can see that one is much closer. 53% believe that you should build a wall, that we should build a wall. 43% say that they should not build a wall. So it just kind of gives you that contrasting difference in opinions that we did on those 8 questions. Okay. Again, what we did with that is we also went through and tracked what are some of the changes that you saw over time. And again, are there any differences in opinion based upon the county, the 3 counties that we survey? So again, what I did here is just highlight a couple of each of them. So one of the questions we asked was about presidential approval. So this would have been 2020. So this would have been approval of former President Trump. You can see that between 2019 and 2020, the residents had a higher approval rating and the disapproval rating dropped a little bit. Okay. One of the questions I took a look at, I picked an example of the county comparisons here. Again, one of them, abortion, is it the women's right or is it morally wrong? And you can see in this situation that in your county, it's 68% to 26%, which again, notice that in Jefferson County, it's a little bit closer, and Lewis County, it's a little bit closer. But again, you can do these kind of comparisons for any one of the questions in the survey, in the entire survey instrument. I mentioned that we did ask a couple of questions about COVID-19. So again, what we did is we did a study in April of 2020 in direct response to the COVID-19 pandemic. We decided to postpone our annual surveys, and we worked with some of the local health organizations or public health organizations to see what kind of information might be helpful to you in terms of how you can potentially help the residents of the county. And we asked to see, we had a much larger group of questions there. We scaled it back a little bit and asked about a dozen questions this time. A couple of the highlights, some are very expected. Early on, people were not wearing masks. They're wearing masks more often now. The concern with the information they're seeing in the media went up in October compared to April. We asked about the satisfaction level that they have with the different levels of the different response levels we're getting from the different organizations. So notice that the national level, the CDC, the positive response dropped. The national level in terms of the president's office response dropped. The state level, it dropped. But notice, look what happened with the local organizations, okay? The satisfaction with the local public health organizations, okay, increased where the others all decreased. So the satisfaction level is dropping at those higher levels of government, but the local level, they were getting more and more satisfied, okay? And then the last thing we asked was just how big of a problem do you think COVID-19 is? And again, we just said, is it a major problem? The worst is behind us. Is it a major problem? It's still the major problem. It's still worse is yet to come. Or do we not believe it's a major problem at all? And again, in April, okay, only 5% of people thought it was a major problem and it was behind us. Okay, most of the people, 87% said major problem, worse to come. A very small percent said it's not a big problem. By the time we revisited it 6 months later in October, the worst behind us, as you might expect, went up. Okay. Worse yet to come, you might expect went down. But again, this might be one of the more shocking items that 4% of people thought it wasn't a major problem back in April. By October, okay, that was up to almost a quarter of the participants believe that COVID-19 is not a major problem. So a couple of pretty big changes in response to COVID-19. Next set of questions. Again, this is a question that we ask every year. It's a way that we track people's financial situation. And again, this is one that, again, you might expect as a result of COVID-19. Again, what we saw in 2020, 31% of people indicated their personal financial situation had gotten worse in the past 12 months. Only 8% of people said that it had gotten better. Okay, which I don't think is probably all that shocking with what you might expect. If you take a look, it's almost a perfect switch from what we saw 2 years ago in 2018. 2018, it was 29% better, 11% worse. 2020, 8% better, 31% worse. Okay, which again, I don't think is probably totally expected based on the environment that we've lived in for the past 12 months. Okay. Again, the direction of the county, the direction of the entire country. So we actually asked about the direction of the entire country in 2019. In 2020, we decided let's ask about the direction of the country again. Let's also take a look at the direction of St. Lawrence County. And if you look in St. Lawrence County, it's a pretty even split about what people think about, are we heading in the right direction? Are we heading in the wrong direction? 36-34. Okay, and you might say, well, maybe that's a little bit concerning. But take a look at that compared to what we see with the entire country. In the entire country, again, in 2020, it's 27% to 54%. So in the county, it's about an equal split of people that are saying, yeah, we're in the right direction, wrong direction. In the country, there are 2 people that think it's going the wrong direction for every 1 person that thinks it's going in the right direction. So again, just some contrast about what we think from a local perspective opposed to a national perspective. Very similar to what we saw with some of those satisfaction levels in terms of the response to COVID-19. And again, you can see the county comparisons. We saw similar things in the other counties. It's just that the positivity rates in both Jefferson and Lewis County were a little bit higher. Okay, so we did see a couple of differences countywide there. We did ask 2 questions I mentioned about the potential legalization of marijuana. We asked, were you supporters opposed to sale of marijuana? And we asked whether or not you would support or oppose growing it and allowing farmers to profit from it. And you can see that there's overwhelming support opposed to opposition. 61% support, 23% opposed, almost 3-to-1 ratio of support to opposition. In terms of farming it to grow it, it's even greater. It's over a 4-to-1 ratio. So for the most part, it looks like there is much more support for the potential earning, for the earning potential from this new industry opposed to opposition. So that's just something, especially what we've seen in the last couple of weeks, that might be particularly of interest. A couple items here. I did mention that we did study internet access. So again, we do see that almost everyone in the county has internet access at home. It's less than 1% of people indicate they don't have internet access. So again, the actual access isn't an issue. Again, the idea of both working and working remotely and learning remotely from home, it's a little bit, almost 1 in every 4 people reported that they're working remotely from home. Almost 3 in every 10 said that there's someone in the home learning remotely at the K-12 level, and it was about 1 out of every 9 that say that they're learning remotely at the college level. That was a quick try to run through. I know that you guys had a really loaded agenda, and I know this one looks to be pretty loaded as well. Probably what I would want to stress the most is something I mentioned early on. We will be collecting data for the next study in about 6 weeks. We're scheduled to do it early on, either 1st or 2nd week in June. And we would love to include some questions that would help you answer some questions for anything that you might have coming up in the future. So if there's any way that you think that we could help you collect some information on any of the topics that you guys might have of interest, please reach out to myself or to our director, Joel Alone, and we would be happy to help you either formalize some questions. If you want to make sure we ask a question again that we did ask this year, if there's a particular topic that you want some more information on. So if there's a topic that, okay, you asked about that, do you want to know why they think that? We're more than happy to add additional questions if there's a topic that you'd like to look at in a little bit more detail. Okay. Anybody have any questions?
Any questions?
I know that was a sprint. I tried to be respectful of your time there. But again, I mentioned that Jason does have the full report, so hopefully he's able to disseminate that to you at some time soon. And again, if you have questions on anything in the report, feel free to contact me or contact Joel, and we'd be happy to get in touch with you again and look at the report in full detail and see how you might best use that information.
Mr. Danforth, I've seen your report before. It is all encompassing as far as the information that you provide. It is also very useful, and I hope that this board can provide you with the questions that we certainly have on our minds for you to consider to include in your survey, in your study. So unless there are some questions, and I don't see any right now, thank you again, and we all look forward, I'm sure, looking at the material that you provided to Jason. So, again, thanks.
Thank you very much. Thanks. Have a good evening.
Thank you. Jason, we're going to get to you very quickly, but I want to start out with the regular agenda here, starting with emergency services. And Matt Denner, and the first resolution for that is authorizing the chair to sign memorandums of understanding to establish emergency shelters for the County Animal Response Team, CART. Is there a motion to move this? By Mr. Arquette, seconded by Ms. Curran. Mr. Denner.
Good evening, everybody. Kind of like what Joe said, this MOU for which we all know we have the county emergency response team. So this is a blanket MOU so we can sign them, a blanket resolution so we can sign MOUs with potential shelter sites that are coming up here in the future.
Okay, any questions? Seeing none, all in favor? Aye. Opposed? Carried. The second resolution is authorizing the chair to sign a contract with the New York State Division of Homeland Security and Emergency Services, Office of Interoperable and Emergency Communications for an FY18 statewide interoperable communications targeted grant and modifying the 2021 budget for emergency services. Moved by Mr. Denisha, seconded by Ms. Curran. Matt?
This is the grant that we've kind of been waiting for the last few years to start the process for our radio upgrade. A portion of it will go towards the PSAP here in Canton, some renovations to that and some updated equipment, but the majority of it's going to go for starting our new radio project.
Are there any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. Matt, thank you very much. Have a great
Thanks, guys.
evening. Okay, next is Sheriff Brooks Mayborg. And the first resolution is accepting donations to be used towards the implementation of an additional K-9 team, equipment, and training. Is there a motion by Mr. Smithers, seconded by Mr. Perkins and Ms. Curran and Mr. Fay? Excuse me. Sheriff?
Thank you. Good evening, everyone. So this is resolutions for a second K-9 unit. We have one presently. I'm looking to add another one probably sometime next year. I've already got some donations into our office in the last couple weeks. I put this on our website and our app. So I need to create an account to put these funds into to get donations for the purchase of this K-9 unit.
Are there any questions or comments? Sheriff, what's the cost of that? What's the total cost?
Well, luckily in the past, we've had the purchase of K-9s usually go through other donations, or HSI purchased our last dog in training. So the significant amount of cost was down. I put in $25,000 because it may come into a vehicle or insert for vehicles, the cost of the dog, the training. So up to $25,000. I don't think it's going to get to that, but we'll see where it goes.
Okay, thank you. Mr. Forsythe.
Thank you, Mr. Chair. Brooks, what's it going to be used for specifically, the K-9?
It'll be mostly for tracking. We have a dog now that's into illicit drugs and tracking. The tracking component is the one I'm looking for mostly for this dog that we're going to get next year.
Okay. Okay, thank you.
Sure.
Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. The second resolution is authorizing the chair to sign a federal equitable sharing program agreement and annual certification report for the sheriff's office. Moved by Ms. Curran, seconded by Mr. Perkins and Mr. Reagan. Sheriff?
So this resolution we do yearly. It's obligated to for the federal equitable sharing program for our annual certification report and in our agreement. So we need this resolution to go forward.
Any further discussion? Seeing none, all in favor?
Aye.
Aye. Opposed? Carried. The next resolution is proclaiming May 15th, 2021 as Police Officer Memorial Day during National Police Week in St. Lawrence County. Moved by Mr. Denisha, seconded by Mr. Reagan, Mr. Akers, Mr. Smithers, and Ms. Curran and Mr. Sheridan. Any discussion? Sheriff?
So this resolution is for our National Police Week. We recognized them last year for all law enforcement agencies, whether it be sheriff, town, village, or state, federal partners. Obviously, more of the stressful environment we've had during the COVID and some other things that have been occurring nationwide. We want to make sure we dedicate service to these law enforcement agencies. So I'm looking for this resolution to be passed.
Any discussion? Seeing none, all in favor? Aye. Any opposed? Who had their hand up? Margaret. Margaret, did you have your hand up? I missed it, I'm sorry.
That's quite all right. I just wanted to ask, is this Memorial Day for people who died in the line of service, or is it just for people who died?
No, this is just for the operation of any law enforcement agency. This isn't really for a memorial.
Oh, okay. Because it says proclaiming May 15th as Police Officer Memorial Day.
Right. Well, memorial, not for death, but what they do in the public.
Okay. Thank you very much.
You bet.
I think it's remembering them for their service, not necessarily that they gave their lives.
Correct.
So this resolution has been passed. Thank you, Sheriff.
Thank you.
Next is the Board of Elections resolution, Jenny Bacon and Tom Nichols. And it is a resolution authorizing the chair to sign contracts requesting grant extensions for poll worker training and voter education. Is there moved by Mr. Smithers, seconded by Ms. Curran and Mr. Denisha. Jenny or Tom, whoever wants to go first.
This is just extending the deadline. In the resolution, it does say the 42,000. That's what's currently on the contract. We did spend some of that money last year purchasing equipment for our training for election inspectors, but the state has not yet deducted it. So it's still 42,000 on the contract, but the actual balance is 35,374.48. And we can only use that money for poll worker training or voter education.
Okay. Mr. Nichols?
Enough
Anything
said.
to contribute? Nothing? Okay.
You didn't ask twice.
All in favor? Aye. Any opposed? Carried. Thank you very much. Jennifer Fotenauer, we have a discussion for the lead grant. You want to do that one?
Sure, yes, good evening. Thanks again for accommodating Mr. Danforth. I will just mention that the full report is available on Google Drive, so you should have access to that. If you don't see it, just give me a call and we'll get you a copy of it. So yes, the lead grant monthly update, some slow and steady progress since last month. We have an additional application. We have several other interested individuals that we have applications out to. We have 2 additional signed contracts new this month over last month. Production, of course, is not where we would like it to be. We would still like to see it a little bit higher, but we are continuing to struggle with some of the issues that I've mentioned before, just the high costs, the big ticket items, the large houses that we have to deal with here in St. Lawrence County are over and above what has been allotted for the amount per unit. So that requires a continuous negotiation with HUD for each unit. It's going relatively well. We just need to have that discussion, and we do meet on a bi-weekly basis with our HUD representative, where we talk about the high cost of the units here, as well as our production levels, and also just the struggles that not only St. Lawrence County is going through, but really the rest of the country, that we're all facing similar production lags because of the high cost of building materials, the delay in a lot of building materials that are out there. So it is unfortunate, but it is not unique, certainly, to St. Lawrence County. We did have a meeting today with our subrecipient and have additional information that will be going out to look to get additional interest in the program. So we are hoping now that the weather has broken a little bit, we can get a little bit more of the outside work done with some of these projects, that things will start picking up again as well. So happy to answer any questions specifically on this project.
Any questions? I don't see any hands, Chief.
Okay.
You want to move on to the broadband survey?
Sure. Happy to. Thank you. The broadband survey is winding down now. The last day to submit a response is the 30th of this month. April 30th is the last day. We have over 1,500 responses to date, which is a pretty good number. Of course, the more the better, but we did have sort of a check-in a couple weeks ago to see where we're lacking survey responses from. So we're doing sort of a targeted response in 9 particular towns: Oswegatchie, Fowler, Edwards, Louisville, Madrid, Norfolk, Gouverneur, and Waddington. So if you do represent those communities, if you wouldn't mind just giving a plug at the local meeting, if you're attending, or just when you're out and about talking with individuals in those communities, that we'd like to see some more response from those communities. We have just some other quick stats here. 11% of the respondents have reported that they have no internet access. So out of that 1,500, about 150 or so have no internet access, and 34% report that they are not able to purchase the speed that they need or want from their local provider. So additional information to come. Once the survey closes, the consultant will be putting together a report and presenting that. Lewis County just received their report from the same consultant a couple weeks ago. And so we'll look to get a similar response from the consultant that was presented in Lewis County. And happy to answer any questions on this topic as well.
Mr. Rinaldi.
Thank you, Jason. I just have a quick question about the statistic you just gave, the 34% that said that they're not able to get enough speed from their provider. Is that because they financially can't afford it, or because it's not available? Does the survey specify?
Right. My understanding is that it's not available. So I will look a little, I'm sorry.
Like I'm sorry, but the person taking the survey, would it have been clear to them? Is it like that I can't because I can't afford to, or I can't, like it's not an option in the package?
Right. I don't have the survey right in front of me, but let me go back and take a look at that question. That's an excellent question. And we'll see if we can get you an answer.
Great, thank you.
Sure.
Anyone else? Mr. Reagan.
Jason, I've had conversations with people in the Macomb, Morristown, Briar Hill area who've said that Verizon is putting in, or they've been told by workers that Verizon is putting in FiOS into some of those areas, but when they call Verizon, they can't get any information about it. Do you guys have any information or any indication that anything like that is happening in some of the rural areas that are currently feel they're unserved? Because I've heard it from a whole bunch of people that it's not far from their home and they can't access it.
Yes, I have heard the same comments about FiOS being run on a number of roads in DePoyster, in Macomb. I did some anecdotal information. I did talk with one individual that I know personally who was explaining to me about the FiOS run and that he is now connected. So I think that yes, it is being run. We can get you some information. And my understanding is that was a program that was let through the state broadband initiative of a couple of years ago. That Verizon was the winner for that competition, and that this is the build out from some years ago, funding from some years ago. I know the Development Authority of the North Country has information, more specific information on that build out area, and I'm happy to get that to you. But in terms of the connection, the run versus the actual connection to the system, presumably once they run it, they're going to want to have people connected because that's how they're going to make some money off of it. So I'm assuming that that's just a little bit of a lag there, that if it's run, they're going to want people to connect to it.
When you talk to the Development Authority, can you have them take a look at those areas to see how far away, I've been told by residents who are upset that, they're only a couple hundred feet from the pole, and they can't get any response from Verizon as to whether or not anything will ever occur. It was my understanding with this, the purpose of this survey is to help, bring about an expansion of services. And since, I recently read where Verizon is doing a huge expansion of FiOS in rural areas, anything we can do to make that last several hundred feet to get to some of these people, would mean a great deal in terms of its impact on their lives.
Absolutely. Yeah. Yeah, I'll reach out to Dank and just see what additional information they may be able to provide to us and get that back to you.
Any other questions? Seeing none, all in favor? Excuse me, we don't need to be in favor, do we? Forgive me. Thank you, Jason, we appreciate it. And if you could get that information out, I'd be interested in it too, because I heard the same thing. They ran it right by my house all the way to Morristown. And, not a connection from Ogdensburg to Morristown, but they continue to go and they're very close-mouthed about it. So it would be interesting to see, because I think we've got an obligation to do what we can for those people that don't have service or that aren't going to get the service. They need to get something. So, and I think that's been proven over and over again. So thank you very much for your work.
Thank you.
Our next resolution is setting a date for a public hearing on proposed local law B, number to be determined, for the year 2021, allowing 12 and 13-year-old licensed hunters to hunt deer with a firearm or crossbow during hunting season with the supervision of an adult licensed hunter. Mr. Forsythe moves it, seconded by Ms. Curran. Mr. Arquette, Mr. Akers, anybody else? Mr. Denisha, Mr. Sheridan, Ms. Haggard. Any discussion? And Mr. Perkins.
Thank you, Mr. Chairman. Mr. Denisha, the only it's not really discussion. I would just request to be added as a co-sponsor.
So noted. Mr. Forsythe.
Thank you, Mr. Chair. This one's kind of near and dear to my heart, and I'm sure several others on this board. I saw it in North Country Now. So I think as soon as I saw it post on the internet the other day, I reached out to Kelly. I says, can you pull up my old one? Because I brought this forward, I think 5 or 6 years ago, encouraging the board to move forward, New York State to move forward with allowing 12 and 13-year-olds to hunt. I think it was Rick brought up a good piece 5 years ago, worrying about 12 and 13-year-olds with a high-powered rifle with no supervision. This covers that. It's with a licensed adult. I just encourage you all to support this. As a father who shared watching his 2 sons shoot their first deer, I can attest to how great a day that is. And my daughter shooting her first turkey, and several other young hunters shoot their first whitetail. I was a little discouraged by the Lewis County Sheriff saying he didn't feel they were old enough to understand their actions. I wholeheartedly disagree with that statement. I think if he shared those moments as I have, and probably many on this board, they wouldn't know what I'm talking about. So I encourage you all to support it, and thanks for bringing it forward. Thank you, Kelly.
Mr. Urquhart.
Thank you, Mr. Chairman. My dad came from a family impoverished and was hunting to feed the family well before he was 13. He turned that unfortunateness into a hobby that he enjoyed until his death. He taught my brothers and I how to hunt ethically and efficiently. What I'm seeing is so many of our youth today in the technological era are staring into phones constantly, well before they're 13. So I really think any activity that could encourage them to get out and enjoy our wilderness and get away from that for a little bit is very encouraging, and I support this wholeheartedly. It needs to be done in a responsible manner. Obviously, when you're out there, there's a danger, there's a risk, but nonetheless, it's a hobby again that's really fitted for our county here in St. Lawrence, and I'll be strongly supporting this resolution.
Ms. Hager.
Oh, thank you, Mr. Chairman. At first, when I read this, I, of course, freaked out because I'm like, oh my God, they're too young. But I don't know where we got this from the Office of the Commissioner of the DEC, but they are explaining it. Did everybody get this? Did this come in our mail or something? Okay. Talking about the law and all the specifications, and after I read through this, it sounds very sane. And like Mr. Forsythe mentioned, this is within physical distance, they will be supervised. So any trepidation I had about the age of these people, because I do know a lot of 12 and 13-year-olds, having taught them, all these requirements that they're asking and are very sane, so to speak. And I thought that was a really good letter to kind of convince people. So maybe it could be used as part of any information that we send out to the public on this. Thank you.
Thank you. Anyone else? Seeing none, all in favor? Aye. Opposed? Carried. The next resolution proclaims May 6, 2021 as National Recognition Day for Nurses during National Nurses Week in St. Lawrence County. Moved by Mr. Smithers, seconded by Mr. Forsythe, Mr. Fay, and Mr. Denisha. Any, and Ms. Curran and Mr. Arquette. Any discussion? No discussion. I've been married to a nurse for over 50 years. My mom was a nurse. They both graduated from the same school of nursing at A. Barton Hepburn Hospital. My mom came to Ogdensburg to get her MRS, and my wife did too. So I got to tell you, my whole family is either in the medical profession or in one form or another, and it's a great profession. When my mom passed away, I can't tell you how many nurses that worked on her floor came through, and story after story after story. It's great. They're great people. They serve, and back in the day, they served for just about nothing. So I think it's a great thing to do, and I totally support it. Mr. Arquette.
Well, if your wife was a nurse, she was also a saint.
Yes, she is. I knew I was going to get it.
I just like to add to that, you know, we have some tremendous doctors that heal us up, but in the interim, the nurses really are the ones that you know, to provide that level of care that gets us through those trying times, and I absolutely appreciate every single one of them for the work that they do. Very difficult work, and wonderful people. Thank you.
Anyone else? Mr. Fay.
I'm going to say something too. My wife taught the nursing at the nursing program, retired as a director for over 30 years, and she was a practicing nurse before she went into teaching for about 6 years in New York City, 5 years.
There's another saint, Tony. Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. Vacancy committee review.
Yes, sir. So there are 5 departments scheduled for this agenda, single except for Board of Elections considerations. The first one up this evening is probation. Tim? Good evening.
Everybody.
Go ahead.
So this is a backfill from a promotion that you guys were gracious enough to let me fill. Been 6 months now, the position's been empty. I wasn't in a rush to fill it because of the what's being getting full-time again. It's time to fill the position and get the person trained. So I'm asking to finally fill the backfill.
Questions for Tim? Okay, thank you, Tim.
Thank you.
Next position for consideration is from the public defender.
Hi, everyone. So this position actually has a companion one with the county attorney. I'm guessing that's going to be heard on at the finance committee. This position is fully grant funded. The idea is that one of my assistant public defenders will move down to the county attorney's office, and the current deputy county attorney will take my attorney's spot, which is higher than the base salary as listed, and we'll cover, hopefully able to cover that still with all the grant money associated with the Harold Herring case.
Questions for James? Okay, thank you, James. Next up is Brooks for the sheriff's position.
Okay, thank you. Looking to fill a detective sergeant promotional position. If you remember, a few years ago, we were at 4 detective sergeants and we pared it down to 1, and making the other 3 detectives to save money and to kind of rearrange our detective division. This position not only serves the supervision of our detectives major crimes unit, but it in turn also supervises our drug task force unit. So obviously very instrumental in our supervision of those 2 units.
Questions for Brooks? Okay, thank you, Sheriff.
Thank you.
Next, we have Tom, because
Yes.
both these positions fall on Tom's side of the office. Go ahead.
We had a resignation in the office, creating a vacancy in the deputy commissioner position. So I had to make a very quick decision because with petitions coming in the late March, I had to have a backup in case we had to take care of any unforeseen circumstances for legal purposes. So we moved up Jesse Sovey temporarily, and I'd like to fill that position permanently at the next board meeting. The backfill will be the data management technician position, and I'd like to begin advertising for that so that can be filled at the same time.
Questions for Tom? Okay, thank you, Tom.
Thank you.
And last one for consideration this evening is from the conflict defender, which is a create and fill. Hi, Amy.
Hi, how is everybody? This is a create and fill position for our, under the criminal justice Harrell Herring statewide expansion, and it's fully funded, and the attorney would solely deal with criminal cases. One of the biggest hurdles for our office in the past year and a half approximately have been the DATs, the desk appearance tickets. I don't know if everyone's familiar with those. Whereas in the past, pre-COVID, we would attend local court appearances once a month or every other month, which was much easier to manage. Once the DATs commenced last year in 2020, we're expected to go weekly dockets. So it's very hard to provide that kind of coverage with the limited staff we have in our office. At one point, public defender was assisting even on some of the conflict cases, rather than having those assigned out to 18B. But once the court started reopening later in the fall and even this year, we haven't really been able to do that. And a lot of the courts are not adjourning to days when we are available. A lot of the criminal courts are during the day, not as many as in the evening as they used to be. So there's a lot of overlapping. We have the in-person appearances, the virtual appearances, and it's just very hard to be everywhere at once. So that's what we're requesting to build our staff on the criminal side under the criminal funding. And I did provide previously to the vacancy committee a copy of our county plan under the Harrell Herring, the 5-year plan of where this would fit in overall in the budget.
Questions for Amy? Okay, thank you, Amy.
Thank you.
Moving to the county administrator's report.
Yes. So COVID-19 update, generally I give you a few items related to county operations. We talked already a little bit tonight about employees returning wholesale starting Wednesday, April 21st. We will monitor that carefully with plans to reopen our facilities the first or the second week of May. Certainly we've seen increases. You saw the averages creeping up a bit. And certainly we have not seen the last yet of the traveling population during the school vacation, but hospitalizations are up as well. And certainly we always like to be reminded that that is the reason we look at the case numbers altogether. So we'll monitor those, and if a different decision or conversation should occur based upon that, I'll bring that back to you next week and as we progress through this process. I did want just briefly in the vaccine conversation to commend Jolene, to commend public health and all the partners in their creativity converting UCB1, or our unified command vehicle, and emergency services for lending it to us, for reaching people where they are. And certainly to express our gratitude to Governor Rescue Squad for becoming a provider to assist us with the homebound, as well as the New York State Police, who may be able to assist us with that population in the near future. It's outstanding to continue after all these months and after crossing the year threshold of COVID-19 to continue to see the creativity of staff. So we're very proud of the work that they're doing and will continue to do as we go forward. The executive orders have been extended to May 6th, and Legislator Smithers was inquiring a bit, but it does provide for the hybrid meeting setup to continue. Just as an aside, our neighboring counties have returned to in-person meetings this month. They are a few weeks ahead of us with regard to their staff returning. So they had a March 29th, April 1st timeframe. We're extended out to May 6th at this point. So I thought perhaps at the May board meeting, we could have another dialogue. By then, I think we'll know if the executive orders will again be extended, and the board can make a determination at that time. Courthouse staffing, we got an update from the Office of Courts Administration. They're returning to 100% on May 24th. So that will, I believe they've been at 60%. So that will see an increase here at the courthouse in Canton. Did just want to mention briefly the American Rescue Plan procedures. I think we've been able to come up with a bit better firm or comfort level with the numbers that have been shared. Checked with our federal representatives as well as NISAC. We have confirmed the county stands at 20.9, and combined the towns and villages are at 11.82 towns, villages, and city. So we're continuing to look forward to guidance on how we would seek those funds. We do have 4 years to make use of those funds. And certainly there are areas of the state that were heavily impacted on a sales tax front based on COVID-19. And I'm sure that those counties and municipalities will be seeking those right away. Fortunately, we weren't in that situation. What I'd like to do is to discuss assembling a group to work on the county's portion of those funds. And if the impact could be felt, if we plan it well, we could have a decade-long impact with the funds that are being provided through this process. I have started a process to gather data with regard to the impact of the legalization of marijuana with the impacted immediately, and then the indirectly impacted departments like the sheriff, the district attorney, public defender. What changes do they expect to see as a result of this legislation changing, and how can we bring a summary of that to you so that as we start, in the coming months to plan for budget, there will be a different threshold. There will be changes on the work that's required of them. So I'd like to provide you with a summary of that. They're reviewing the information, they're talking and having meetings with their state associations, and we'll look to bring some information to you in the next month's time. And then I did just want to mention as an aside, Legislator Fiacco did have to sign off, and Legislator Haggard, I believe, will provide her report under committee reports. And that's all I have unless there's questions.
Any questions? Mr. Burke.
Ruth, my question is regarding DSS. On February 11th, there were several of us that were given an overview of the state of DSS, and they had a 3-year plan. And I guess I'm wondering, Ruth, the number of children in care hasn't decreased. The caseloads have increased. Open investigations are up, and every dollar that we save by not hiring case managers, we're losing $2 to $3 in what it cost us for foster care and other care placements. Now, I know that there's been questions about the assessment itself, but I'll tell you, it lingers with me. I'm wondering if every day we let this slip, if we're not compounding the problems that are there and the problems we're ultimately going to have to face. And so, I mean, I'm aware of what the plan was for 3 years. Is that still the plan, or do we have a different assessment and a different plan? Again, I hate the thoughts of not providing the services that we need and the protection we need for children. And I also hate the thoughts, as I'm sure all the rest of the legislators and you, Ruth, do, of losing money. So again, if the assessment is not accurate, I mean, I'd love to have somebody else's assessment of where we are with this. But I'm really concerned that either we have a plan or we don't have a plan, and either we have an assessment that we're going on, or we don't have an assessment at all. And it's concerning to me because again, two big factors. Our children's welfare is at stake, and the cost to taxpayers is at stake. So I hope I'm not putting you on the spot, Ruth, but for me, again, if the assessment was wrong that we were handed on February 11th, then let's have another assessment. If the assessment was accurate, then what is our plan?
Can I respond to that? Mr. Chair, can I respond to that briefly?
Yes, you may.
So a few things, John. I think out of the board's action of March and April were 17 positions that the department is working to fill. And I think out of that, there's a different philosophy and a different strategy that have been spoken to with Family First. And that focuses on the foster care piece and the children's services piece. One very exciting thing that I hope to share with you with Cindy in the next month or two, we're hopeful in May, but possibly June, is to bring you some new metrics. John, if you recall with community services, now it's an automatic that each month you get very real-time data that you can make informed decisions based upon. And that is a direction that we'd like to bring you with regard to children's services and other areas certainly as well. I think one of the most important things using that example is you have information each month that now you can measure against performance. And that's what we'll be looking to do. So there's a work happening now also with Family First, like I spoke to briefly, about looking at some of the assessment pieces that are going to be required. And if in fact we could provide those internally, why wouldn't we? I know that the information coming forward has been slow from the state with regard to how to provide those services and what's going to be required in order to meet or find success and ensure that those reimbursements are possible for the county. So I think there's a number of things based on the kids in care alone and the number of foster care homes we have available to us that are good places to start. But I think we've been in agreement looking at those monthly statistics. While they give you data, we'd like to improve the data that you receive. And so I think a combination of that will better inform legislators, but certainly filling those positions and trying to get those caseloads addressed will be helpful too. And I believe they're working on that right now. And as far as an assessment goes, we can do that as well and provide you with information. I hope that's helpful.
It is. I guess just to share, my sense is that there's a burning fire in our house, and I'd like to know that we got a plan to extinguish it, Ruth. You know.
Understood, John. And I think some good things are happening. Some people are looking to fill those spots, and we'll keep you informed.
Okay.
Any other questions?
Seeing none, we'll move to committee reports. Ag and Farmland Protection Board, Mr. Denisha.
Mr. Chairman, Ag and Farmland Protection Board met on Thursday, April 1st, 6 o'clock via Zoom. And the biggest area of discussion was the annual review for adding properties to ag districts in 1 and 2. There was a public hearing. There were we had applicants, and there was a public hearing that was held on virtually on April 13th at 7 o'clock via Zoom to give the public an opportunity to comment. And recommendations from that public meeting will be presented to the Board of Legislators at, I believe, next month's Operations Committee meeting. The next meeting will be Thursday, October 7th.
6 p.m.
Thank you, Mr. Venetian. Alternatives to Incarceration Board, Mr. Burke?
Nothing to report, Joe. There's been no meetings.
Thanks, John. Ms. Fiacco is not here to report on the Board of Trustees for the Supreme Court Library.
Mrs. Haggard's prepared.
Ms.
On her
Haggard is
behalf.
going to do it?
Yes, on her behalf.
Go ahead, Margaret.
Thank you. This is going to be really tough. They have not had a meeting, so there is nothing to report.
Fair enough.
The Emergency Medical Services Advisory Board, are you going to comment on that for Ms. Curran?
I don't have any updated
You don't have any?
information.
We'll get it next time
Finance,
around,
perhaps?
Rita. The Environmental Management Council, Ms. Terminelli.
Yes, sir. So our last meeting was on March 17th, and our presentation was from Dr. Jess Rogers. She's the Associate Professor of Environmental Studies at SUNY Potsdam. And she came to us to speak about some work that she's doing with some interns on mapping invasive plants along the roadsides in the North Country, specifically the purple loosestrife. Over the past 3 years that she's been working on this project, she's seen a 40% increase. They're primarily on the roadsides, and hoping in 2021 to work with both DOT and the Department of Highways to do some strategic mowing. But interestingly enough, they're looking at different ways to kind of control the population of the invasive, and they've looked at the clip and tip, or clip the tip, they've looked at mowing, they've looked at dig them up, and what they found the most success in is actually a beetle management project. So she is growing and harvesting beetles that they release, and they feed off the purple loosestrife. And so they're on their 3rd year of home growing those beetles. They started with 150. They net and they raise them, and they end up with about 6,000 beetles. This is the same method that's being used downstate in Ontario, being that it's it's a little bit more environmentally friendly. The beetles return to their habitat. So that was that presentation. And some of the other subcommittee reports, the Committee on Resource Management is looking towards trash presso. And I don't know if I've mentioned this at previous meetings. They've been looking into this since I started with the EMC. But basically it's a plastic compressor, and it compresses plastics down into almost like you could use them as building, like bricks, pavers, things like that. So they're looking to get a 1-year lease to have it come to the county. It's like a trial basis where we could actually see how it could help us with our reduction of plastic waste. The Environment and Economy Committee is trying to work to pull some data together to help assess the effectiveness in Ogdensburg, Madrid, Messina, with looking at bypasses and ladders per the request of Mr. Lightfoot. So I think the next step in that is possibly to speak with the board in Madrid and see what their preferences would be as far as providing educational materials, so that we could maybe make a recommendation to them, or the committee could make a recommendation or provide materials that may let them go forward with either consideration. Let's see, Watershed Management Committee, we revisited the topic of the fish possible contamination of fish being served in restaurants, as we see the St. Lawrence perch kind of advertised throughout the county. Just making sure to know where your purchase or your fish in general that you're consuming at restaurants is coming from. And a mention of the St. Lawrence watershed, that there should be an inventory and management plan that would include all bodies of water, similar to what they have in the Adirondack watershed. That's kind of a grassroots effort, a lot of volunteers that actually take samplings and monitor both water quality and fish population in different bodies of water, so that we have some kind of an inventory and management plan that's based on volunteer work that's done consistently. And that's about it. Again, this is our 50th anniversary, so they're hoping to have some projects rolling out as COVID restrictions kind of subdue a little bit. And I think that's all I have.
Thank you, Nicole.
You're welcome.
Fire Advisory Board, Mr. Denisha.
Hey, Mr. Chairman, Fire Advisory Board met on Thursday, April 15th at 7 p.m. via Zoom. Unfortunately, I was unable to attend because I had a conflicting meeting at the same time. However, on Sunday, yesterday, Emergency Services Director Matt Denner and I met in Star Lake with reps from the Fine Falls, Star Lake, and Cranberry Lake Fire Departments in regards to enhanced radio service in the area. And that will, it's already been a topic of the Fire Advisory Board, but it will continue. And our next meeting is Thursday, June 17th.
Thank you very much. The Jury Board, Mr. Sheridan.
Mr. Chairman, the jury board has not met recently.
Thank you. Planning Board, Mr. Fay.
Hey, our planning board director, Jason reported on the lead grant update and the broad grant survey. I'd like to add a few other things to it. One is that we looked at basically the use variance in Norfolk for trailer, and we basically recommended that they not accept it. One of the reasons that surprised me is that they didn't want to put a trailer on that's over 25 years old onto the property. It's one of the things that I never heard of. Okay, and basically looked at Rossi's land use regulations for revision. The county planning office is taking care of how to work on that. In Oswegatchie, we looked at a special permit for solar array on State Route 37, right behind the Wadhams Hall Seminary on Wadhams Hall, or the Diocese of Ogdensburg property, for a solar panel. I believe that's the fifth one we've approved in Oswegatchie. Jason's still with us, you can maybe correct me, but we've had a lot of them approved in Oswegatchie, and the last one I'd like to report on, which I think is economic development for us, that goes through on a large parcel on Arconic land. A greenhouse is going to lease. When I say on Arconic's property, it's basically if you were heading to the St. Lawrence Mall on Route 37, across the river is Alcoa's property and now Arconic. And they're proposing a $32 million greenhouse project that will create over 100 jobs on that property. And I don't know if the Watertown Times had it right or not, but they said it was going to make sure that you could have vegetables delivered within a 24-hour driving distance. I think 24 hours could get you to Florida. So maybe I missed that in the 24-hour radius, but I'm not sure what that is. So, but it's hopefully going to create over 100 jobs. That will be part of the meeting as far as I was.
What's the acreage on the solar farm on 37?
It's no, it's on 37. Who I can't tell you how much.
You said next to Wadhams Hall.
That's what it's behind Wadhams Hall. Right. Again, this is going to be leased property, I believe, not sold by Wadhams Hall, just as our current properties.
Jason's on the roof of farm. Go ahead,
Jason. Did you have correct me or add to it?
Sure, yeah, just a couple points on the solar development on 37. There are actually two solar projects side by side, one on the roof of property and then one on Wadhams Hall. They're both 5 megawatt projects. That's about 25 acres of panels. The Roofer Road one is just slightly bigger than the Wadhams Hall development. And just a clarification, there have been 7 projects in the town of Oswegatchie over the last year and a half or so.
I forgot to add the 2 we had approved it.
Yeah. Yeah. Growing like bad weeds, aren't they? Is there any old or new business to attend to? Mr. Forsythe.
Thank you, Mr. Chair. I guess it's new business, kind of old business. St. Lawrence River water levels. We went up, opened our camp yesterday. I've been going since 1966, my family, same year. by far the lowest ever for this time of year. If something doesn't drastically happen quickly with raising the water levels, it's going to be the most dismal boating season on the St. Lawrence River ever. So I don't know if it's planned 2014 with 2 extreme high water levels and now a low water level. I don't know what it is, but I pulled up the average snowfall for 2020 was average. So you can't blame it on the snowfall. Something's largely wrong with this whole picture. But off the end of our dock would normally be 4.5, 5 feet of water. There's 1 foot of water and nowhere to put a boat in. And all the docks along our whole section are going to be in the same boat. There won't be any boats able to get onto a lift. So I don't know. I don't know who we scream to or I don't know. I guess we just hope for rain, but something's drastically wrong. Something's terrible. So just my thoughts.
Anyone else under old or new business? Seeing none, we have need for executive session for litigation and personnel. What in regard to personnel?
Medical, financial, credit, or employment history of a particular person or corporation or matters leading to the appointment, employment, promotion, demotion, to discipline, suspension, dismissal, or removal of a particular person or corporation.
Your motion to go into an executive session.
And did you say appointments?
I did.
Apologize. Okay. I need that as well.
By Mr. Denisha, seconded by Mr. Smithers. All in favor?
Aye.
Aye.
Opposed? Carried.
Okay.
Is there any other business to come before this committee tonight? Seeing none, we're adjourned.